I extend a warm welcome to all the people who are joining us in the webinar number 160, organized by the Andean Health Organization Polytunano Agreement. This cycle of webinars began in May 2020, and in this new year, 2023, we will continue to share these spaces of interlearning with the best information available, and as always, based on evidence. As a reference in health in the region, we continue uninterruptedly the joint and coordinated actions with the 6 member countries, Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela, thus fulfilling the goals and objectives to strengthen the health of our people. As a reference in health, we highlight a message for the critical epidemiological situation in the region. Faced with this tridemic, the epidemic of the 3 viruses, influenza, COVID-19, and respiratory syncytial virus, it is recommended to intensify vaccination campaigns and remember that the protection of the vaccine against COVID-19 is renewed with booster doses and that the priority age group due to greater vulnerability are the elderly. Therefore, it is essential to complete our vaccination schedules. It is also important to maintain care measures such as the use of face masks, hand washing, and isolation of people with respiratory conditions. Remember that in places where there is a higher concentration of people, the risk of contracting COVID-19 increases, and then for ventilated spaces and use masks all the time, they remain in closed spaces. It is important to remember that vaccines against COVID-19 are available for seniors, adults, and youth, as well as our children. It is important to prepare them for a safe return to school. And let's not forget of the health personnel who's in the first line of battle. Let's protect our family against COVID-19. We highlight as an organization the importance of solidarity and respect for people. Well, in accordance with what has been said, today, Thursday, February 16, we open our virtual doors to discuss a topic of great importance for our region with a webinar 160, Advances and Challenges in the Fight Against Childhood Cancer in the Andean Countries. We invite you to leave us your name, organization, and country from which you are joining us through the comment box of the Facebook Live or YouTube Live chat. In that same space, you can leave your questions or send them to our email to webinarhorasconu@gmail.com. To access the certificate of attendance to this webinar, as usual, you must fill out a short survey and leave your data in the fixed link found in the Facebook Live or YouTube Live chat. The certificate will be sent to your email in the next few days. This webinar will be developed with the usual dynamics. We will start with the institutional greetings and the dissertations of our speakers and the space for Q&A. To begin this important day, I give the floor to Dr. Maria del Carmen Calle, Executive Secretary of Horas Conhu, who will give the welcome and institutional greeting. Go ahead, Dr. Calle. Thank you, Lucho. Thank you so much. Good morning. Good afternoon. Welcome to today's webinar. Yesterday, we commemorated the International Childhood Cancer Day. It is based that every children with cancer deserves the best medical and social care, regardless of their country of origin, economic status, or social class. It is also supported with the premise that the death of children with cancer is avoidable, with a precise and timely diagnosis, availability and access to treatment and appropriate care. Every year, we know that it affects around 400,000 children between 0 and 19 years of age worldwide, every year, and at least 29,000 in the Americas and the
Como
Caribbean
en
region.
muchos otros problemas de salud en la
As in many
región,
other health
las
problems in the
desigualdades
region,
sociales
social
impactan
inequalities have a
negativamente en
negative
el
impact
pronóstico
on
de
the
los pacientes
prognosis
con
of
cáncer,
cancer patients,
siendo las niñas y
with
niños
children and
adolescentes de
adolescents
países de
in
ingresos
middle
medios
and
bajos.
low-income countries
Ellos presentan cuatro
being
veces
4
menos
times less
probabilidad de
likely to be
progresión
cured than
comparado
those
con casos
in
en países de
high-income
altos ingresos.
countries.
Las causas de estos escenarios
The causes
equitativos
of these negative
son los
scenarios are late
diagnosticados, la
diagnosis,
falta de
lack
acceso a
of
servicios
health
sanitarios y
services,
medicamentos,
and access
la
to drugs for
baja
cancer treatment,
adherencia a los
the
tratamientos
low
médicos
adherence
y
to
trabajos
treatment,
campo.
among others.
El Organismo Andino de Salud,
Aware of this
mediante
problem,
el Convenio Hipólito
the
Unanue,
Andean Health
en
Organization Hippolyte Unanue Agreement
contexto dispone con la resolución
provides
553
with
aprobada
resolution
en Lima
553
con la que
approved
se
at the
llevó a cabo
REMSA
en Lima, Perú, el
held
25
in
de
Lima,
noviembre de
Peru on
2022,
November 25,
se
2022,
aprueba la
which
política andina de
approves the Andean
prevención y
policy on
control del
cancer
cáncer,
prevention and
que
control,
establece lineamientos
policy that
estratégicos
established strategic
consensuados
guidelines
con los
agreed
seis
upon
países,
by the 6
Bolivia,
countries,
Chile,
Bolivia,
Colombia,
Chile,
Ecuador,
Colombia,
Perú y
Ecuador, Peru,
Venezuela,
and,
y la creación del
and
Comité
the
Andino de
creation of the
Prevención y Control del Cáncer
Andean Committee
para
on
la
Cancer Prevention and
elaboración,
Control for development,
implementación y
implementation,
monitoreo
and
del Plan de
monitoring
Acción
of the
2023-2030,
2023-2030 plan.
conformado por los
A
puntos de
committee
interés
that
locales
made up by
responsables
the
de los
cancer focal
temas de
points
cada
of the
uno
6
de los seis países
Andean
andinos
countries
y que trabajan
and that works
coordinadamente.
actively.
Muchas gracias por el trabajo.
Thank you very much for
Una
your
de las
effort.
actividades de este comité
Within the activities
fue
of this
elaborar
committee,
el
the
documento
document
Situación
Cancer
del Cáncer
Situation in
en
the
la
Andean region
región,
was prepared,
y actualmente se
and
encuentra
currently
desarrollando el
the
documento
document
sobre
on
situación
situation
del
of
cáncer
childhood
infantil
cancer
en
in
la
the Andean
región.
region is being
Hoy
prepared.
compartiremos las
Today, we will share the
perspectivas de la
perspectives
agenda de
of the
cáncer
cancer
en la
agenda
región andina
in the Andean
desde el punto de
region
vista
from
de
the
Horace
point of view
Cono,
of Horace
y
Cono.
también
We
contaremos
will
con
also
ponentes de
have
la Organización
presentation
Panamericana de la
from
Salud
the Pan
sobre la
American Health
implementación de la
Organization on the
iniciativa de
implementation of the
cáncer
Childhood
infantil
Cancer
en la
Initiative in
región
the region
y la importancia de los
and the importance
mecanismos de
of cooperation
cooperación
mechanisms
para
to
abordar la
address the
problemática del
problem of
cáncer.
cancer.
Seguidamente, los
Then, the
representantes de los
representatives
Ministerios
of
de
the
Salud de
Ministries of
ambos
Health of the
países
Andean area
expondrán
will
sobre los
present on
avances
the
y
progress
desafíos
and
en el
challenges in the
control del
control of
cáncer
childhood
infantil.
cancer.
Agradezco nuevamente la
Thank
presencia
you
de
all
todos
for
ustedes.
your presence.
Bienvenido, doctor Hernán
Welcome, Dr.
Sepúlveda,
Hernan
doctor
Sepúlveda,
Mauricio
Dr.
Maza, doctora
Mauricio
Liliana
Maza, Dr.
Vázquez,
Liliana
doctora
Vázquez,
Patricia
Dr.
Gallardo,
Patricia
puntos
Gallardo,
focales de cáncer
Focal Points for
infantil de la
Childhood Cancer of
Iniciativa
the
de
Andean
Prevención y
Committee
Control
for
del
Cancer
Cáncer.
Prevention and Control.
Bienvenidos y bienvenidas a
Welcome
este curso
participants to our
anual
webinar number
que nos presenta
160,
avances y
Advances
desafíos
and
en la lucha
Challenges in
contra
the
el cáncer
fight against
infantil en los
childhood
países
cancer in the
andino.
Andean.
Un saludo especial a
A
la
special
doctora Julia
greeting
Palma
to Dr.
Werner
Julia
de
Palma
Chile,
from
a la
Chile,
doctora Nubia Bautista
Dr.
Bautista de
Novia Bautista
Colombia,
Bautista
a
from
la doctora
Colombia,
Yerenis Herrera
Dr.
Prieto de
Yaneris
Ecuador y
Prieto
la
from
doctora
Ecuador,
Esi Madariaga
Dr.
de
Esi
Perú y
Maradiegue
la
from
doctora
Peru,
Reina
and
Copana
Dr. Regina
Valdivieso
Copana
de Bolivia.
Valdivieso from Bolivia.
Bienvenidos, bienvenidas.
Welcome. Thank you, Dr. Calle, Executive Secretary of the Andean Health Organization, for your institutional greeting and welcome. We will now welcome Dr. Hernan Sepúlveda from the Sub-Regional Program for South America of the Pan American Health Organization to give the welcoming remarks. Go ahead, Dr. Sepúlveda. Thank you, Lucho. Thank you to the Andean Health Organization for this initiative. Adds to the set of initiatives that, as Luis mentioned, are spaces to exchange experiences and to exchange different modalities to face the major challenges in public health. My greetings also to Liliana and to all who are present, the country, like Marisela, for joining us. This meeting is extremely important for our sub-regional program with the perspective of the strategic alliance that we ever had with the Andean Health Organization to address these themes. Cancer has always been a permanent concern in our program. Today, we've been working intensely with Dr. Patricia Gallardo. We also had an effort with some countries with regards to the cancer registry. But as Mari Carmen mentioned, yesterday we commemorate the Childhood Cancer International Day, and it is important just to provide some data with regards to what she has already mentioned. First, in Latin America and the Caribbean, approximately 29,000 children and adolescents are diagnosed with cancer every year. So in Latin America and the Caribbean, out of every 360 children and adolescents is diagnosed with cancer each year. And at least half of the countries of the region have a national policy for early cancer detection, including childhood cancer. So this is an interesting information that even though the regional rate of survival in childhood cancer is of 55% as an average, this changes from one country to another. In the countries with low income in the region, for example, children and adolescents suffer of survival rates as low as 20%, while countries with higher income have survival probabilities that go up to 80%. This brutal difference, Mari Carmen mentioned, has different causes, but it's mostly due to the delay in diagnosis, the lack of specialized care, limited access for essential medications, and preventable mortality due to infections. So although childhood cancer could not be prevented, most of these cancers can be cured if they are detected on time. Therefore, the information that parents, caregivers, health teams is crucial to guarantee an timely diagnosis and, of course, to save their lives. And precisely that is why they commemorate this International Day of Childhood Cancer, to create awareness, to support children and adolescents that have cancer, to support survivors and their families. In this context, I would like to insist that we discussed yesterday regarding the chronic renal disease with an event organized by the Horas Conju that has to do with the role of the first level of care and the early diagnosis. We know that early diagnosis is essential in the life of children and adolescents with cancer. So the preparation at the first level of care, as not only the physician, but the first level teams in Chile, we have an experience of nurses that perhaps our colleague from Chile could comment. That's going to be essential. The preparation of the first level staff in the virtual Pan American Health Organization course on public health. There is a course of early cancer in children and adolescents that is aimed towards the first level of care teams that would be interesting to review and discuss and retake. This is a permanent challenge, has to do with the structural conditions of the countries, and we are, it's important to consider that in countries where they improve survival, we need to work on that, and in that regard, the Horas Conio initiative is quite valuable. So we're available as a team from Washington and the sub-regional effort to support this significant initiative of the Andean Health Organization, and thank you very much for the invitation. Thank you, Dr. Sepúlveda, on the sub-regional program of the Pan American Health Organization on Cancer. Now we will ask Dr. Mauricio Massa, Regional Advisor on Cancer from PAHO and WHO, for his welcome remarks. Go again, Dr. Massa. Thank you very much for giving me the opportunity. Actually, following the words offered by Dr. María Carmen Calle and Dr. Sepúlveda, there's not much that I could add. in terms of the reality of this problem that we have at the region level in the Americas. For me, it's a pleasure to be with you today and support initiatives that will improve the comprehensive approach of childhood cancer in the region. It has been well mentioned. We know that childhood cancer, if it is diagnosed and managed on a timely basis, has a high rate of cure. But unfortunately, that's not the reality in many of our countries because we have limitations with the different diagnosis tools, access to drugs, and other difficulties that produce those results that are not optimal, like the ones we see in developed countries where the cure rate is much higher. That is why perhaps if I go back to talk about the global initiative that in 2018 the WHO launched with the support of St. Jude Research Hospital and different organizations of civil society with this global initiative called Cure All. And as part of this initiative, we do the analysis in different regions, countries throughout the world. And as Dr. Sepulveda mentioned, in our region, we have approximately 29,000 new cases and unfortunately 10,000 deaths in those under the age of 20. So Cure All for our region and Cure All Americas support different components of the health systems from the situational analysis up to support in working in the implementation of action plans that are carried out by each country that is part of the initiative. We currently have 17 countries in the region which are part of this initiative. Several are also starting the last phase, which is the implementation of the plans. And that is why I'm very excited to look at this initiative that with support of the sub-region office from the organization has organized and work together with the Andean Health Organization to support the Andean Health Plan in the diagnosis, the baseline diagnosis of childhood cancer in the six nation country, Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela. The joint effort is something amazing for us. In addition to this initiative, this can lead to many other efforts, but something that is clear for us as a Pan-American Health Organization is that when countries get together to work for initiatives that support the region or the sub-region, we obtain much more efficient outcomes and we have a benefit for the people that are most vulnerable. And with this message of congratulations for organizing this and getting together and having so much continuous education and projects to follow, this is a great happiness of me to share this with you today. Thank you very much for letting me the time to share this experience. Thank you, Dr. Mauricio Massa. And now we will be followed. I'm going to introduce myself. I'm Luis Bingolea Moore, medical epidemiologist, coordinator of the Andean Committee of Cancer Prevention and Control on the Horas Conyo, and I'm in charge of the moderation. To begin, I invite Dr. Maria Carmen Calle, Executive Secretary of the Horas Conyo, for her presentation, which is the perspective of the cancer agenda in the Andean region. Go ahead, is Dr. Calle, the space is yours. Thank you, Lucho. You always provide a biography of some of the speakers. I would just like to mention that I'm a pediatrician. I have a master's degree in governance and health management with a public health PhD, and I fully committed with childhood cancer. When I was the General Director and Vice Minister of Public Health in Peru, we've worked intensively so that childhood cancer has a clear position, because it's also the issue is also to position these disorders so that they can lead to a greater participation of the governments in the diagnosis, treatment, because we're all convinced that without budget, there are no rights. And that is very obvious when we talk about childhood cancer, as we're going to. So this is a quick review of the perspective from the cancer agenda in the Andean region and the Andean Health Organization. As you know, the Andean Health Organization was created on December 18, 1971, and was added joined the Andean Integration System in 1998. And our maximum authorities are the ministers of health of Bolivia, Chile, Ecuador, Colombia, Ecuador, Peru, and Venezuela. We are part of the Andean integration system, and we have remained with these 6 countries during these 56 years of effort. We're not talking of small amounts of people. We're going to talking about more than 168 million people in our 6 countries, with the largest population in Colombia and the lowest one with Bolivia. Our observer countries are Argentina, Uruguay, Paraguay, Brazil, Panama, Spain, Cuba, Guyana, Dominican Republic. These are the current ministries of health of the 6 Andean countries, which we are working directly. About Dr. Jason Ausa from Bolivia, Dr. Jimena Aguilera, Chile, Dr. Carolina Corcho from Colombia, Dr. Jose Ruales from Ecuador, and also Dr. Rosa Gutierrez from Peru, and the lawyer Magali Gutierrez. We have 2 Dr. Gutierrez in the Ministry of Health. In this case, this is the Minister of the People's Power for Health in Venezuela. How do we work? We work in committees. The most important committee is the Technical Coordination Committee, that is made up of the representatives of international cooperation offices of the different countries. And at this moment, we have 20 committees, 3 subcommittees, 6 working groups, 1 Andean table, and 1 Andean net. What are the committees related with this topic? We have the Cancer Prevention and Control Committee and Prevention and Control of Chronic Non-Communicable Diseases Committee. In the Strategic Health Integration Plan 2018 to 2022, our strategic line 4, Andean health priorities, and also in the plan we talk about these strategic lines, multi-sectoral policies and partnerships for the prevention and control of non-communicable diseases, NCD risk factors and protective factors, health systems response, surveillance, and research. In the risk factors reduced and protective factors strengthened and increased, we had the following objectives: reduce tobacco consumption, exposure to tobacco smoke, reduce harmful use of alcohol, promote healthy eating to promote health and well-being, and to promote active living, to promote health and well-being throughout the life course. Well, I mentioned this in a meeting. Non-communicable disease and cancer have a great impact on the health of the population in the Andean countries, which is why it is a priority to promote the preparation of joint plans and projects, as well as to comply with the health policies prepared for this purpose. Prevention and control of non-communicable diseases within this committee, we've made a situational diagnosis of overweight and obesity in the Andean region as an input to elaborate the Andean policy to face the pandemic of overweight and obesity. Diagnosis of physical activity in Andean countries, the baseline study of the alcohol consumption situation in the Andean level that's soon going to be published, the study analysis in the advances of food labeling in the Andean countries from a multi-sectorial perspective, and the diagnostic situation of cancer in the Andean countries. This can be seen in our web. Cancer in the Andean countries. The first cause of cancer in men in the Andean countries in the 6 countries coincide that the first leading cause is prostate cancer. Second, 4 countries indicated stomach and Venezuela and Bolivia, lung. When we talk about women, breast cancer is the first one in 5 out of the 6 countries, and in Bolivia we have cervical cancer. And in second place, in Chile and Colombia, we have colorectal cancer. In Ecuador, Peru, and Venezuela, we have a major problem with cervical cancer. In Bolivia, we're talking about breast cancer. Childhood cancer is the second leading cause of death among Latin Americans and Caribbean children up to 90 years of age. And 29,000 children are diagnosed every year, and the most common types are leukemia, lymphoma, central nervous system tumors, Wilms tumor, and retinoblastoma. These were the resolutions of Horas Conio. We have a resolution in April 4 and in November of 1994. And following that, we have the resolution of November 25 of 2022 that approved the Andean Policy for Prevention and Control of Cancer and the Andean Committee of Cancer Prevention. It doesn't mean that the working group was not working for several months before in order to achieve this. In 2020, 1.4 million deaths, and 47% of which were in people 9 years of age or younger. The number of cancer cases in the region of America was estimated in 4 million in 2020 and is projected to increase to 6 million in 2040. Now let's talk about childhood cancer. Each year, more than 29,000 cases of cancer are diagnosed in children under the age of 14, and it's estimated 10,000 deaths caused by this disease. In low-income countries, 1 out of every 2 children will die. But the main childhood cancers treated can have up to 80% of survival rate. This is the list according to Global Can of 2020. We're talking about the Andean region, 0 to 19 years of age, and we have leading causes with leukemia, tumors of the central nervous system, testicular tumors, non-Hodgkin lymphoma, Hodgkin's lymphoma, and so on. These are the death and mortality rates due to cancer. Leukemia being the leading cause, brain and central nervous system, and not Hodgkin's lymphoma. There is a meta-analysis of the surveys published after the first wave of this pandemic. They include 50 surveys reporting data on 9,150 providers from 121 countries in 5 continents. And treatment cancellation and delay occurred in 58% of the centers, delayed outpatient visits in 70%, changes in treatment plans in 65%, and overall reduction of clinical activity by 58%. If we look at the DALIs, due to neoplasms, we see that the Andean region is above Latin America and the Caribbean, and of course above income countries. When we look death rate, we have the Andean region of the same groups that mentioned before. Now let's talk about environmental carcinogens associated to childhood cancer. You have the reference here. High intake of animal products, fats, and sugars may be associated. Exposure to ionizing radiation, pesticides, animal hygiene products, asbestos in road pavement, school parking areas, and school playgrounds. and the recognition of carcinogenic agents makes it possible to identify their impact on health, which is why it is essential to know the different risk factors in the child population and thus generate more effective and specific preventive and control measures that can reduce the overall burden of disease. Where are we now? Where do we want to? How are we going to get there? Step 3 includes two additional questions. How do we know if we have reached to that point or not? And how are we going to do the follow-up of the progress? At this moment, we have an Andean policy for cancer prevention and control that has 10 strategic lines: integrated care model, healthy lifestyles, prevention, detection, and diagnosis, strengthening the oncology network, quality of life of patients, strengthening the stewardship, the human resources training, strengthening management, financial protection, and social and intersectoral participation. As I said before, we had the prevalence of different type of cancers. This has been already published, but we are now with the baseline study of the childhood cancer situation in the Andean region. Strategic Line 01, development of the integrated cancer care model by life course. This model of integrated cancer care brings together in a comprehensive and systematic way all the approaches, perspective, and strategic lines of the Andean policy of cancer prevention and control. Although childhood cancer cannot be prevented, most cases can be cured with chemotherapy, surgery, and radiation therapy. The survival rate in high-income countries is 80%, and in low-income countries is between 20 and 55%, as is the case in Latin America. Low survival rate is an expression of inequity in access to effective diagnosis, essential drugs, pathology tests, blood products, radiotherapy, technology, psychosocial care, and palliative actions cannot be postponed. We have the Andean policy, and we would like to share our strategic lines for the 2023-2030 strategic plan. The health as a central access for human development, right to health with social and environmental justice, reduction of inequalities and inequities in health, and institutional strengthening, integration, and regional cooperation. This is the roadmap for health as a central axis for human development, political positioning, because health is no longer the focus now, the validated and disseminated scientific knowledge, human resources in health trained, and health promotion in the right to health with social and environmental justice, an approach of human rights assumed collectively, the strengthening of our systems, and consider human, animal, and environmental health that in a comprehensive way in one health. Reduction of inequalities in health, the approach of multiple inequalities and inequities collectively consider, plans and policies to reduce them, gender gaps and generation and territorial gaps reduced, and cultural and racial gaps reduced. In the, forgot number 3, no, it's fine. Institutional strengthening, integration, and regional cooperation. These spaces of cooperation and Andean coordination must be strengthened,
cooperación,
common challenges,
cooperación
Andean
debería
cooperation, and cooperation with strategic
ampliar
partners
y
that
fortalecer.
is increased and strengthened.
Siempre terminamos
I always
nuestras
finish
presentaciones
our
con este
presentations
cuadro
with
dedicado
this
a todos
painting
los héroes
dedicated to
y
all the
luchadores
workers
que se quedaron en
who
el
fell
camino para
by
salvar a los demás.
his side to save others.
Agradecidos y agradecidas
Eternally
por su
grateful.
apoyo. Desde el organismo andino
From
de
the
salud,
Andean Health
Bolivia,
Organization,
Chile, Colombia,
Bolivia,
Ecuador
Chile,
y Perú,
Colombia, Ecuador, Peru, and
estamos
Venezuela,
totalmente
we are
convencidos
fully
de que
convinced
juntos
that together
somos más
we
fuertes
are
y
stronger
juntos
and
llegamos
together
más lejos.
we
Muchas
reach
gracias por su
farther.
atención.
Thank you very much for your attention. Big Dr. Calle, we reiterate our gratitude for your presentation and we invite you to remain in the room. At the end, we will conduct a dialogue in response to questions from the audience. We welcome Dr. Liliana Vasquez. She's international consultant on childhood cancer on the Pan American Health Organization and the World Health Organization. For her dissertation, implementation of the initiative of childhood cancer of PAHO and WHO in Latin America and the Caribbean. Welcome,
Muchísimas
Dr.
gracias.
Vasquez.
Muchísimas gracias ante todo
Thank you very
a
much
María del Carmen
to
Calle,
Dr. Calle,
Luis
Dr.
Bengolea
Luis
y
Bengolea,
todo el
and to
equipo
all
andino de
the
salud
team
por
of
esta
the Andean
gentil
Health
invitación
Organization for this
a
kind
este
invitation,
webinar tan
for
importante que
this
son los
important
avances y
webinar
desafíos en la lucha contra el cáncer
with
infantil
respects
en
to
los
the
países de
advances and
Andean
challenges in the
Countries
fight
y la
against childhood cancer
implementación
in
de la
the Andean
iniciativa de
countries.
cáncer
Talk about
infantil,
the implementation of the
como bien
childhood cancer
comentó el doctor
initiative.
Massa, está
As Dr.
avanzando en
Massa
los países de la región
indicated,
y cómo es
it's
que
been
se
worked
está
on in many countries of the
implementando,
region. Let's
a
look
qué
at the
nivel y cómo es que
implementation,
podemos
what
seguir
level it has been
avanzando,
done,
como
and how
mencionaba
can
María de
we
la Calle.
move ahead
Yo
together.
quisiera empezar la presentación con
I
una frase
would
que
like
me
to
gusta
start a
mucho
presentation
de
with a
nuestros grandes
phrase
colegas y amigos de
from our
St. Jude,
colleagues and friends
y
from
es que
St. Jude,
ningún
which
niño
no children
debe morir en el
should
amanecer de su
die
vida.
in the dawn of
Y
their
esa
life.
es una frase muy
And
poderosa
this
para
is a very
nosotros
powerful
también,
phrase
porque
for us
significa
because it
mucho en
means
relación a lo que
a
queremos
lot
nosotros
of
con
in
nuestros
terms
hijos,
where
la
do we
función
want to
que tenemos
arrive,
nosotros, cada
what's
uno de
our goal
nosotros, en el rol que
for each
tenemos
one of us and the role that
en el
we
país en que
fulfill
nos
and in the
encontramos.
country that we're
Y
living.
definitivamente el cáncer infantil ya no es una
Childhood
enfermedad.
cancer is
Cada
a,
año, y lo mencionaron hace un minuto,
as it has been
por lo
mentioned,
menos
every
29,000
year at
niños y
least
niñas nacidos
29,000
con cáncer van a ser
boys, girls, and
diagnosticados
adolescents are going to
en
be
nuestra región.
diagnosed
De
in our
ellos, la
region
gran
with
mayoría van a
cancer.
venir de
Most
países
of them
del
come
sur,
from South
de
American countries, followed
Centroamérica,
by
República
Central America,
Dominicana, Haití,
Dominican Republic,
México
Haiti,
y un
Mexico,
porcentaje menor
and
de
another smaller
Centroamérica.
percentage from Caribbean countries.
Y como lo mencionó también la
And
doctora
as
Calle, y
Dr.
algo que
Kaye
quisiera
mentioned,
resaltar mucho,
something that I would like to
es que
highlight
no
is
todos
that
estamos
not
partiendo del
all
mismo lugar.
are
Las
starting from the
inequidades
same
existen y
place.
sobre todo en
Inequities
cáncer, porque
exist,
no, el
and
cáncer
especially in
infantil
cancer,
nos
especially
hacen ver de
childhood
que
cancer, makes
existen
us
grandes diferencias y
realize that there are major
desigualdades en
differences and
algunas de estas
inequalities in terms of
manifestaciones
the
según el país en el que nos
chance to
encontremos.
of
Por
cure
ello es
depending on
que
the country.
la curación del
So
cáncer
that is
infantil
why the
sigue
cure of
siendo un
childhood
reto
cancer is still
y
low in our
que
countries.
por lo, por lo menos
At least
encontramos, según
we
las
find,
cifras, un
according to
3
numbers,
veces más de
two or
mortalidad
three
presente
times the
en
higher
países con
mortality
capacidad de
seen
ingreso
in
económico.
countries
El
with high
promedio de
economic income.
mortalidad que tenemos
The
en nuestros
regional
datos, un
average,
55%,
although it
existen
is true that
grandes
it's
diferencias. Hay
55%,
países en la región
there are
que
major
tienen
differences in
survival
their
rate
countries in the region that
100%
have survival
hasta
of 20%,
50%,
and
en la región que
countries in
podemos
the region that may
decir que
have
sobreviven. Y
80%
no
survival.
podemos permitir
So we
que haya
cannot
tantas diferencias
allow those
siendo
large
países de la
differences
misma
being
región sin
countries from the
contextos
same region.
y por qué es importante
And
también,
why
y
is
yo
it
saludo
important?
muchísimo el
And
trabajo
I
de
greet
la
the
región
work of the
andina, que es
Andean Health Organization who
importantísimo.
support us.
Sabemos que existe una gran prioridad
We know
para
that
el
there's a
cáncer infantil, como
priority
lo
for
mencionaba,
childhood cancer, as Dr. Kaye mentioned.
porque en la subregión andina
In the
hay
Andean
un aumento
subregion,
incluso de la
there's an
mortalidad,
increase
incluso
in
comparándonos con
mortality,
otros
even when
países
we
de la
compare
región. Por
with
eso
other
es
countries in
muy
the region.
relevante
So
poder
it is
tener
very
este
relevant
espacio, este
to
foro
have
de
a space,
discusión
the
en el que
discussion
se
space like this one,
definen
where
estrategias,
we can talk
avances
about
y cómo
strategies, challenges,
beneficios
and
de
progress
la subregión
that we
andina y
have
cómo
as
mejorarlos.
countries in the Andean
Nuestro
sub-region
rol
and to
como
improve them.
país, en cierta
Our role
medida,
as
en
Pan
la
American Health
Conferencia Mundial
Organization
de Cáncer Infantil que se
in
lanzó en el
this
año 2018,
global
busca
initiative, childhood cancer,
transformar
is to
la
transform
visión global de la
the
iniciativa
global
desde
vision
el
of
manejar el paquete técnico,
WHO
las plataformas
initiatives, the global framework, the technical package, and the platforms that are available to improve the care of children with cancer and turn them into knowledge. It's a network effort that we see in this group and the working platform with tools and promote, and of course, to promote leadership that is important to mobilize stakeholders. So then we can transform that in action. What we need in each one of the countries, and it's going to respond to each one of the needs and priorities that are established in each one of those countries in order to develop and to implement plans, policies, programs, projects, and interventions, national situation analysis, and study cases. But of course, this is going to be dynamic. I am a firm believer that the childhood cancer initiative is going to follow many of the experiences that we're going to share in our countries and going to respond to this global and regional agenda of all the interventions that are going to be offered today in the countries throughout the region. Because this is a joint effort. This is an effort that is implemented from the government, from the member states, with the support of the health teams within the United Nations agencies such as PAHO, but others, St. Jude, collaborators, and foundations, among others. That is why, for us, this is Cure All Americas. It has a global effort, but with a national and regional approach, a very local effort where it's allowing us to learn from the neighbor country and from the major experiences and progress made in our countries between government authorities, civil society, and health teams. And as a regional office, we have also set strategic office objectives around 3 points. One, which is the plans and health policies and the legislation in childhood cancer. It's important to promote national regulations that support children with and adolescents with cancer, that provide well-being and social protection to their families. The second point is to improve the essential care and the quality of childhood cancer, because we need to implement projects that we call essential projects or cure all, based on topics that are of a concern: pediatric cancer register, essential medicines, referral systems, training, and problems that are common to all, that we should not start from scratch, because there are many good practices and examples in our region. And in thirdly, the decrease of the impact of these factors associated to mortality. It's not rare or crazy to think that in many of the Andean countries, we share different problems. Treatment withdrawal, the high rate of delay in diagnosis, the lack of pediatric palliative care, among others, with the goal of improving survival at least up to 60% to 2030. And as Dr. Massa mentioned, we have 17 countries who are already formally participating as part of this childhood cancer, some with specific activities and others with a dialogue ongoing. This is a network where we can all share. This is a space where we can disseminate ideas, share experiences, not start from scratch, but at least from one, with a higher step. And something interesting of this implementation that has 4 phases. The first one, a situational diagnosis, and we thank the team of Horas ONU for supporting us in being able to visualize childhood cancer as a public problem at the government level, health authorities, and the health teams, and together have a national cancer plan, a pediatric national cancer plan, and then do the implementation, and then to monitor the extremely progress. And indeed, today we have different degrees of progress and priorities depending on each country. Some countries put more emphasis in the timely diagnosis, other more in essential drugs or pediatric cancer registry. When you see it like that, it's a colder look. But if we see there are many experiences that are important in the region, such
en
as the
Panamá,
guidelines for
un estudio
timely
de tasa de
detection,
abandono
the
de
degrees
pequeños
of
en Perú, que es
treatment
creo
with
que un punto muy interesante de cómo
dropouts
organizándonos
in
nosotros
Peru.
podemos
And
mejorar
by
y crear
getting organized as teams, we can
grandes
improve
logros en
and
cuanto
have
a cómo
major achievements
efectivamente se puede impactar a los
of
niños con
and have
cáncer,
an
donde se
impact in
pudo
children
disminuir
with cancer, where we can
nuestro
decrease
tratamiento de un
the rate
18% a
of
un 8.5% de tasa de
18% to
retrabajo que se está
8.5%
haciendo en el
of
país.
children drop
Entonces,
treatment
esta
dropouts
información
in
y de
childhood cancer,
planteamientos específicos para
and
acción
also
para
to have
trabajar en cáncer infantil en República Dominicana,
in the Dominican
el
Republic with
lineamiento de un
a
plan
manual for
específico
timely
para
detection
sostener a los niños
and
y
a
adolescentes con
specific
cáncer en
plan for
Colombia,
children
entre muchos otros
with
ejemplos
cancer
que
in
podemos
Colombia, as many
mencionar
other
también.
examples that we see today.
Y algo también
And
interesante es
something
que miramos hacia
interesting, if
atrás
you
en los
look
últimos 5 años, que
backward
como región,
in
como
the
América
last
Latina y
5 years,
Caribe,
as
hemos
a
crecido
region of
en
Latin
cantidad de
America and the
gobiernos
Caribbean, we have
países que
grown.
tienen la
More and
voluntad,
more
la
countries have
intención,
the
el
political
gobierno, la
will
intención
and
de
the government
poder
has the
desarrollar
intention
e
of
implementar un plan nacional de
developing and
cáncer.
implementing a
Si
national
miramos al año
cancer program.
2017,
If
solo
we
el
look in
26% de los
2017, only
países contaban
23%
por
of
lo menos
countries
con un plan
had
nacional
at least a
y esto
national plan,
aumentó
and
hasta un
that number
40%.
increased up
Entonces,
to
es algo
40%.
que nos llama
So this is
mucho
something that
a celebrar que
calls
se
us to
hagan y se tomen
celebrate
estas iniciativas
and
para
to
nuestro
welcome
país.
these
Y sería muy
initiatives.
importante que
For us,
pudiéramos
it will
tener
be very
muchas
important that at
regiones
least
donde
70 or
mencionar
80% of countries in the
medidas de una
region
política
had
nacional
a
de
national
cáncer,
policy
y
for
esto
childhood
incluido
cancer,
el cáncer
with that
pediátrico.
also, which
Y algo
includes, of
que
course,
me gusta mucho
children.
compartir
And
es
something that I
que
would
esta es
like
una
to share
iniciativa de
is that
abajo
this is
hacia
not
arriba. No es que
an
todos los
initiative
países
that
nacionales,
the
CENYUC,
national
OMS,
collaborators,
vienen a
WHO,
dictar
and youth
una
can to
agenda al país,
establish
sino
an
que es
agenda to the
una
countries. This is
estrategia que
a
va
bottoms-up
alimentándose
strategy
de
that's being
las
fed
perspectivas,
by the
de la
perspectives
experiencia de
and the
cada uno de los
experiences that
países.
each country
Tenemos metas
has.
comunes, pero necesitamos
We
ser
have common goals, what
interoperables,
we need to
necesitamos acelerar
adjust
el ritmo de
the
cambio
real
y
world, to
finalmente
accelerate the
escalar y buscar la
rhythm of change,
sostenibilidad,
and
que es
do
algo muy importante
scaling
también para
and
nosotros.
monitoring.
Y finalmente, en el último tema,
And
que
finally,
el
the
trabajo
last topic,
regional es un
which
trabajo
is the
muy
regional
interesante.
effort,
Efectivamente,
is quite
compartimos
interesting
mucho
because
de
we
los
share
problemas a nivel de
many
nuestro
of the
país.
problems at the levels of
Se
our
estima que
countries.
por lo menos
We've
en la
estimated
región
that
cerca de
at
un
least in the
30%
region,
continúa
almost
abandonando el
30%
tratamiento
children
y
are
esto está
going
mucho
to
más latente, sobre
drop
todo en
off
la
uh,
subregión andina.
treatment,
El diagnóstico oportuno, el
the
seguimiento
timely
oportuno
diagnosis,
de eventos
oncologic
paliativos,
support,
la
palliative
malnutrición
care,
es muy importante como un
malnutrition
factor
is also
prognóstico para un niño con
important as a
cáncer,
prognostic factor
problemas
for
de
child
capacitación y
cancer.
visibilización de
Training,
enfermería,
issues,
trabajo psicosocial.
nursing
Estas
efforts,
son
psychosocial
iniciativas
efforts.
tomadas desde hace 2 años, 7
For the
grupos
last
de
2 years, we
trabajo
organized 7
regionales con
regional working groups
profesionales de 18 países
professionals from
que
18
atendieron
countries
justamente cada uno de
that
estos
consider
temas
each
para
one of
poder
these
proyectar
topics
hacia
in
dos o
order
tres
to
años y
project
poder
2 or 3 years ahead
buscar recursos,
and to look for resources,
proyectos,
projects,
guías, ¿verdad? En cada uno de estos
guidelines
temas.
in each
Y me
one
da
of these
mucho gusto de
topics.
poder compartir después de
And
casi
we
dos
want to
años
like to share
y
two
empezar a
years later,
diseminar estos
start
recursos y
disseminating
estos
these
cursos
process among
virtuales
these virtual courses
disponibles en
that are
español
available in
para hacer el
Spanish
diagnóstico oportuno de cáncer
for the
infantil,
early
en
diagnosis in
portugués,
childhood
en
cancer, in
inglés.
Portuguese, in
Y
English.
yo con mucho gusto les comento que ayer
I
estuve
would like
revisando
to
por la página y
mention
hay más
you
de
that I was
75
reviewing
mil
this page, and
participantes
there are more than
en el curso de
75
diagnóstico
participants
oportuno
in this
de cáncer
course
infantil a nivel
of
del
early
país. Y
diagnosis of
realmente
cancer in
países
children
que
and adolescents in the
sabemos que los
region.
países lo
We
necesitan.
know that
Es
countries
una
need them.
capacitación dirigida
This is a
principalmente a
training
atención
directed
primaria,
to
profesionales de
primary
atención
care,
primaria.
professionals in the
Gracias a
primary care
Dios,
level.
Ecuador, que
I
nos
would like to
apoyó
thank
a
the Ecuador
diseminar
team
esto,
who
y
helped us
Colombia,
with the
y también
dissemination, the team from Colombia and
muchísimo a
Peru who
transmitir
help us how to
estos recursos con
transmit
profesionales.
these
Hemos
resources
lanzado un
with
curso de cuidados
professionals.
paliativos en cáncer
We
pediátrico también,
also launch a
guías,
course on
4
palliative care
documentos
for children,
técnicos
and
importantes
four
sobre
and also four technical
alimentación y
documents on topic I
nutrición,
mentioned:
cuidados orales,
nutrition, oral
enfermería,
care,
psicosocial,
nursing, and
y atención
psychosocial
dirigida
care
principalmente
that
a
are
los proveedores de
directed
salud.
towards health providers
4 análisis situacionales o
for
panorámicos
situation
que
analysis
son documentos muy
that
interesantes
are
que si tienen
interesting
tiempo de
documents
revisarlos
that it
están
would be interesting for you to review and are available in the Pan American Health Organization webpage.
del tema de
Not only show the current
uno de abandono
situation
de
with
tratamiento, cuidados
timely
paliativos, prevención,
diagnosis,
sino también marcan qué
stopping
posibilidades
treatment, or
tenemos
palliative
o qué
care or
oportunidades
nutrition,
de mejora
so we can
tenemos
see what are the opportunities to
en
improve
los grupos
following the
regionales.
expertise of regional
También materiales para
teams.
padres y
And
cuidadores
finally,
es
material for
un
parents
muy
and caretakers
importante
which are extremely
Nosotros
important. We
hemos
have
colaborado
partnered with
estratégicamente
many
actualmente
strategic
con
collaborators
este es
from
el
St.
principal
Jude,
centro colaborador de
which is the
cáncer
most
infantil,
important
para
collaborating
poder
center
brindar
for
una excelente
childhood
calidad de
cancer,
vida para niños y
to
niñas
talk
con
about
cáncer.
quality of life in children with
El material
cancer,
de Emily, que es un
the
material buenísimo
Emily
dirigido para niños
map
específicamente y sus
directed
familias
to
con
children and their
videos del
families
tratamiento, videos
is
de
for
cómo
treatment
tratarse
adherence and
de esta
education
manera.
video and
Y
story.
quería yo compartir con ustedes
And I
también
would
que
like to
otro
share
día,
also
después de la
that
pandemia de
following
ayer,
the
pudimos
Childhood
lanzar una campaña sobre el diagnóstico temprano de cáncer
International
infantil para
Childhood Cancer International
educar a
Day,
niños y
launch
niñas
a
sobre los
campaign
síntomas y
to
signos
create
de cáncer
awareness
infantil en la
on
comunidad,
signs and symptoms of
en nuestras
childhood
familias,
cancer in the
ser
community, in the
educadores.
parents, in the level, in the
Disponible en
educators.
español, en
It's
inglés.
available in
Tenemos
Spanish, in
una gran
English,
cantidad de material para
a lot of
compartir,
material
desde
to share
pósters de canciones y
from
videos
songs
animados
and
para
information
poder
booklets, posters
concientizar mucho más sobre este
to
tema.
create awareness.
Y finalmente
And
comentar que
finally,
nosotros contamos con
mention
indicadores
that we have
internacionales
national and
dentro del
regional
marco global de
indicators
la
and
OMS
this
para
global
poder
WHO
medirnos
framework
igualitariamente, para poder saber cómo
to
estamos
know
avanzando
exactly
y
how
de
we're moving
la
ahead
misma
and
medida.
measure
Esa es la
us
idea.
with the
Y para
same
eso estamos
measure.
preparando un
And
manual de
for that, we're
indicadores
preparing an
cada uno de
indicator
estos
manual
proyectos
based
que
on each one
tenemos
of
y
these
llevarse a cabo con
projects
estas intervenciones.
and these interventions.
Y yo quería dejarlos con una
And I would like to
pregunta
leave
como
you with
retadora
a
acerca de cómo
challenging
vamos a llegar
question
o no a la
if
meta.
we're
Si
going to reach
logramos
to our goal.
el
We
objetivo de la
know
iniciativa
that the
Casa y
goal
Familia,
of
poder lograr una
childhood cancer is
sobrevida
to
del
achieve a
60%
survival of
para el año
60%
2030,
from
no podemos
2030.
llegar
The
a
question,
la
are
meta
we
para el
going to get
2020
to
según
the
las
final
estimaciones
line?
de la OMS
According to recent estimations
hacia el
for
año
WHO
2040,
and
realmente el
IARC,
cambio en la
the
mortalidad,
change in
la curva de
mortality, this
mortalidad
is a
de
mortality
niños,
curve
niñas y
of
adolescentes entre
children and
20 y
adolescents
25
under the age of 20
un
just for
panorama
Latin
que
America.
realmente es
We see the
parece
curve
plana.
and it's
Lo
almost
que
flat.
vemos ahí es que no se
What we see,
estima que va a haber muchos
we don't
cambios en nuestra
estimate
región
major
cuando
changes in our region in
estamos
terms of
hablando de aquí a
mortality.
5,
We're
10,
talking
20 años. Entonces,
5, 10, or 15
si
years
no
from
hacemos
now.
algo hoy,
So if we wouldn't do something,
no
this
va a
is not
suceder.
going to
Las
change.
proyecciones son muy
The
concretas, son en
projections
base a la tendencia de
are
mortalidad
based on
y
the
se puede dividir
mortality
entre
trend.
países, por supuesto.
It
Hay
can be
países
broken down in
cuya
countries, and of
tendencia
course,
es
there are countries who
disminuir la
have a
mortalidad.
trend to decrease
Pero
this
nuevamente
mortality. But
necesitamos
once
mucho
again,
trabajo
we
sobre
need a lot of
la
work,
subregión
especially in the
andina, donde
Andean
se estima que
sub-region,
muchos
where it
países
has been
están viendo,
estimated
se
that
estima
many
un
countries,
aumento del
where
número de
they estimate
fallecidos.
an increase in the
Probablemente de
number
aquí
of
a
deaths
10 años o
10
20
years from
años
now
hay
or 20
países
years
donde
from
se
now,
estima que no va a haber
countries
tanta
where
mortalidad
there's not
y
going to be
países
any
donde se
change, and
estima
countries where
que
they
va a haber
estimate
una
that yes,
disminución, una
there will be a decrease
disminución de
in that
muertes
number of
evitables
deaths
por
that are
los
preventable in
sabemos
children with cancer.
muertes
We
evitables
talk about
por
preventable
retraso
deaths
en el
because
diagnóstico, por un
delay in
retraso en el
diagnosis,
tratamiento, por una
because treatment
infección.
dropout,
Entonces, eso es algo
because of
que
an
tenemos que
infection.
trabajarlo
So we
hoy
should work this
y nuevamente
today.
tenemos que
And
hacerlo
once again,
juntos.
we need to do it
El
together.
objetivo entonces de nuestra
The goal
iniciativa
of our
Entre
initiative
Todos es poder
is
lograr
to
una
achieve
sobrevivencia por lo menos un
a
60% en
survival of at
2030,
least,
pero en realidad es buscar
but it's actually
sobrepasar este lema que les comentaba de Senyut, que todo
so this St.
niño
Jude's
con
motto that
cáncer no debe
every child
morir
with
en el
cancer
embarazo de
should
su
not
vida y también
die
que
at
todo
the dawn of
niño
their life,
debe tener un
that
acceso
each
a
child should
ser
have
tratado
access
por
to
toda la
diagnose
familia.
and timely
Agradecer infinitamente a
diagnosis.
todos
We
ustedes,
thank,
a todo el
I
equipo que
thank all of
trabajó en
you,
Cure
all
All
the team of
Américas.
for
Invito a
Cure
todos
All,
a que puedan visitar nuestra página
and to
para que puedan buscar
visit our
y compartir
webpage
estos
and
recursos
help us share
que
these
es
resources that
instrumental
are
para
made
todos ustedes.
for all
E
of you.
invitarlos, el día 28 vamos a
And to
tener
invite you
un
on the 28th when I have a
webinar más acerca
webinar to
en
talk about this
temas
topic and many others
desde la OPS.
from
Muchísimas gracias.
Tahoe. Thank you very much. Dear Dr. Liliana Vasquez, for your presentation. We are committed with many institutions to lead this joint effort to face this major problem that affects our children. We invite you to stay, remain in the room, and at the end, we will conduct a dialogue in response to the Q&A from the audience. Now, we would like to welcome Dr. Patricia Gallardo from the South Regional Program for South America of the Pan American Health Organization for her presentation, the cooperation mechanism to address the childhood cancer in South America. Thank you, Luis. Thank you, Doctora Calle. Greetings to all the Pan American Health Organization and to all those. Good morning, and I'm going to share my screen. I'm part of the sub-regional program for South America from PAHO and WHO. I will tell you our work with regards to the cooperation mechanism to address the problem of cancer in South America. The colleagues already mentioned about what has been done, not only at the Latin American level, but global for childhood cancer. This is just a brief summary of what Sepúlveda already mentioned. However, it would be good to tell you that the sub-regional program for South America is a counterpart of the mechanisms of integration of health in South America. In this case, the major effort of Horas Conio for so many years with the technical committee. We also working with Mercosur and the Central America Cooperation Treaty. And what we can see, they have convergent agendas, both the Andean community, Mercosur, and OTCA. They work on health in borders, health integration, health surveillance, development and management process, universal coverage, health promotion and social determinants, non-communicable diseases, environmental health, communicable diseases, and universal access to medicine technologies. And the different mechanisms of integration have convergent agendas. In that regard, the strengths they have identify problems, they address common criteria for diseases, and this is a unique opportunity for the production of regional public goods and the way of facing this problem, facing emergency and disasters, including epidemics. Epidemics could be jointly. We saw it with the COVID-19. The production generation of information and knowledge, construction of consensus, like REMSA, and joint negotiations to promote access to medicines and more effectiveness of diplomacy in global health. There's a cooperation policy in countries for sanitary development known as CCHD. In the South-South cooperation and triangular cooperation is a means to make progress in implementation of the SDGs, and the member states have asked Pan American Health Organization to promote cooperation among countries and collaborate with them and other donors for the establishment of partnerships and mobilization of resources. That the member states requested Pan American Health Organization to promote the exchange of knowledge and good practices. In 2013, a document was issued for the Americas and also a resolution for cooperation for sanitary development in the Americas. In that regard, the objective of the policy to strengthen the cooperation among countries and our horizontal partnership between the regions in order to exchange in the proactive with solutions in the scope in the area of health that address the problems in a more efficacious and sustainable way. In that regard, there's a call for proposals with different stakeholders that contribute to the SDGs for the 2030. The objective is to provide initial or seed financing to mobilize additional resources in the associations of member states that talks about sustainability of the project, that the arrangement should be directed by the country, and we promote the knowledge, resources, technology exchange through partnerships, not only for health area, but the governments, the social civility, the academic community, for the individual benefit of countries involved. Human rights, technology transfer ensures common benefits with institutional strengthening and experiences change. That is why we work with the committee to prevent and control childhood cancer. We proposed under the frame of this policy with the early childhood cancer. The strength, which is important as the project indicates, the different stakeholders and Ministry of Health were the focal points and the PAHO, as well as the representative from Washington. Stakeholders, South America, the main office, the Andean of Prevention of Cancer, and the representative of the Ministry of Health of Bolivia, Colombia, Chile, Ecuador, Peru, and the proposal with the early cancer detection in children is under the frame of the Andean Policy of Prevention and Control of Cancer, the REMSA resolution approved by the Ministers of Health of the member countries from the Horas Conio. This resolution was issued on November 25, 2022, with the Andean Policy of Prevention and Control of Cancer and the creation of the Andean Committee for Prevention and Control of Cancer. This project that is being finished first format with the presentation of the project with this objective strengthen the competence of the health team members and to the exchange of the good practice and methodologies. This is training. Second objective to increase in the member countries the awareness of the early recognition of the signs symptoms of pediatric cancer, the general population, especially parents, caretakers, and educators, and then establish cooperation ties with the South-South cooperation through the exchange of experiences and the implementation of regulations for the timely diagnosis of cancer of childhood and adolescence in the Andean countries. That is why the most important goal is the experience of these countries in the timely diagnosis of cancer diagnosis in children and adolescents with training, development of standards and strategies of awareness, experience exchange, knowledge transference through horizontal cooperation. This will be submitted to evaluating committee in PAHO for the CCHD fund, and if it's approved, it should be executed until December 31st of 2023. That is why to finish, to tell you the opportunity that we have, first of major efforts, and I would like to thank all the committee that with intense effort from my colleagues that were participating, an example of the teamwork of the different stakeholders that are very interested with this. Thank you very much. Thank you, dear Patricia. Really show us an encouraging information of how, after preparing our initial plans to carry out the baseline analysis, we have the possibility of having an triggering input from the initiative of the Andean countries. We thank you once again and invite you to stay in the room. After the presentations given by Horas Conyu and Pan American Health Organization, we'll begin with a space of presentation by childhood cancer focal point of the Andean countries, who will talk about advances and challenge in the control of childhood cancer at the national level. We will begin the space with the presentation of the Ministry of Health of Chile by Dr. Julia Palma Benque, head of the National Cancer Agency of the Ministry of Health of Chile. Welcome, doctor. Welcome. We cannot hear you. We can see your presentation.
Sí, disculpe. Ahí sí se escucha.
Can you hear me now?
Perfecto.
Yes.
Ahí sí. Muchísimas gracias, señor
Thank you very
presidente,
much.
y
My
muy agradecida
apologies.
por la oportunidad de
Thank you for
participar
the
en
opportunity
esta
to
Agencia Nacional
present
de Cáncer chilena
from the
y los
National
logros que hemos tenido en nuestro
Cancer
país en
Agency in
relación
Chile
con cáncer
with
infantil.
the progress made with childhood
Para
cancer
mí
in our
es muy
country.
grato
It
estar
is for
acá y
me
poder compartir con
an
ustedes
honor
la
to be here
perspectiva
and to
de lo
share
que nosotros hemos
the
realizado
perspective of
a
what
lo
we've
largo de
been
los
doing
últimos
in
años.
Chile throughout recent
Nosotros
years.
somos parte de un todo
We are
tratamiento de
part
organismo
of this
autónomo de cooperación,
Andean
el
Health
cual se
Organization
enfoca a través de la cordillera a unirnos
through the
en esta
Andes
iniciativa global contra el
mountain
cáncer
range
infantil.
fight against
Ese es
global
en
this
general un poco
childhood
una
cancer.
mirada de lo que ha sido el
I will
trabajo de
give a
nosotros
brief
como Agencia
introduction,
Nacional de
talk
Cáncer
about our
hacia
national program
su
for childhood
prevención y
cancer and the
presentación.
national plan for cancer.
Sin embargo,
Tell you
en lo
that
que
in the
refiere al
introduction
cáncer
that
infantil,
before
el
talking about
contexto en
childhood
Chile
cancer,
es muy
the
diverso.
context in
Primero
Chile
tenemos
is
una
quite
tasa de
diverse. Children
curación
have
respecto de los adultos
very good
hoy día
cure
de
with regards to adults. In Chile, we
55
have
nuevos adultos con
55,000
cáncer,
new adults
550
with
nuevos
cancer
casos de niños,
and 550 new cases
y
of
tenemos una
children
gran
per year.
inequidad en el
And we
acceso
have
y la
a
calidad
large
de resultados.
inequity
Vemos
in
que
the
solamente
access,
el
opportunity, and
30%
results.
de los
Only
adultos se van a
30%
curar
of adults
y
will
hoy día el
cure,
90% de los
and
niños
today
tienen
80% of
cáncer en
children
Chile.
survive in
Entonces,
Chile.
acá la iniciativa
Therefore, the
es
objective
tratar
of this
de
initiative is to improve
incrementar el acceso
survival
a
of cancer in Chile and
RED.
increase the
El
access
uso va a
to
ser en
RED
Chile la
on
ley
a
15
timely and a
para nacional
quality.
de cáncer de adulto en el
That's a
diagnóstico
national
precoz
adult
infanto-adolescente, pero en esta segunda
cancer
versión se
adult
sacó
cancer plan,
el plan infanto-adolescente
and there was
y
also a
nosotros
separate plan
tenemos
for
nuestro
adolescents.
bolsillo que es enorme,
But we have common
presupuesto
ground, which is the out of the pocket
y un
expense, which is
financiamiento
large,
participativo
and the
también
decrease of
sobre todo en adultos. Por lo
DALIs,
tanto, el objetivo global
especially in
es
adults. So the
mejorar la
global
vida
initiative to improve
de
survival,
niños, de niños
everyone, children
adultos
and adults,
en general,
and in
aliviar la
general,
situación con las
and to
políticas de
align with
salud
the national health
para
strategy that
tratar de
implies
no
to decrease more
cronificarse y tener una
early
atención
mortality
del
with
cáncer
cancer,
desde
and
un
to have
enfoque
a national
solidario,
plan that
eficiente
has a
y
solidarity approach that is
participatoria
efficient
con
based on
acompañamiento
primary
de
health
niños
care
y calidad de vida.
with a
Eso es
dignified
algo que
treatment and
nosotros
quality of
tenemos que
life,
empezar a
which is
analizar
something
en
that we
nuestra
need to
política.
start to analyze in our
Es así
context.
como tenemos lo
That
primero
is
que
why
quisiera
we
hacer
have
resaltar, que son
the
los
first thing that I
resultados
want
que
to
vimos
comment the result
del
of
programa
PINDA.
que nace en el
This
año
is a program that
2008.
was born in
Como
1988.
ustedes pueden ver,
As you
acá
can see,
surge el PINDA y 10 años
we have the
después la Agencia
PINDA, and
Nacional de
10
Cáncer
years we created a
nace en
transplant program.
2014
In
y el
2014,
Departamento
we
de
create
Cáncer es la
the
subsecretaría
Cancer
de
Department
Salud Pública en
in the
Chile
Public Health
y
Subsecretariat.
posteriormente en el
And then in
2018
2018,
el primer
we
Plan
had
Nacional
the
de Cáncer que
first
incluye a niños y
national
adultos en
cancer
la
plan that
región
includes
metropolitana.
children, adolescents, and adults in a
Tuvimos la
single
ley de
plan.
cáncer en el
Then we had a
2020,
national
la
cancer
política
law in
asesora en el
2020,
2021
and in
y la
2021, the
organización de
Advisor
Agencia
Commission,
Nacional de
and
Cáncer
we
el año
created
pasado,
a
en
National
febrero, y
Cancer
posteriormente se
Agency,
empiezan a trabajar
and we
bajo
start
ese
to
paraguas de
work
articulación que
with
tiene
the
que ver entre sectores y
coordination between
áreas del
public health
Departamento del
and
Ministerio de Salud. Es así como en
care
Chile
networks in the
la
Ministry
salud
of Health.
pública
We have a
ha
public
tenido
network
éxito muy importante en los
that
resultados que
has
tenemos.
the
Tenemos
results that we
centros
have
integrales a lo
with
largo de todo Chile,
11
5 parciales
comprehensive
y
centers
5
for
de
partial
apoyo,
and 5
y una red
support,
privada
and a private
similar a los
network
resultados globales
with the global results
de los resultados que voy a poder mostrar hoy día
that I'm
en
going
10
to show
centros
today with 10
fundamentalmente en la región
centers,
metropolitana.
mostly in the
Acá
metropolitan
podemos ver
region.
que la mayor
Here you
parte
see
está también en lo público en la región metropolitana
of it
y eso
located in
es
the
algo que hay que lograr
metropolitan region. This is
con un
something
poquito
that
descentralización.
we need to
En
decentralize in
Chile
the
el cáncer
future.
ha sido entonces un
In
problema de
Chile,
salud
cancer
pública
has
y ha
been a
sido
public
detectado
health
como
program.
una
It
de las
has been
principales del gobierno.
terminus as
Existe
important
el Registro Nacional de
action
Cáncer
areas of the government, and therefore we have the
Nacional de Cáncer
childhood
registra
cancer
casos
national
diagnosticados
registry
y contiene
with
100% de los casos
100%
diagnosticados
of
en
the
la
cases
región metropolitana
diagnosed
en
in
Chile
those
en
under
la
the
red
age of
público
15
y privada.
in the public and
El
private
último
networks.
informe del último
In the
registro de 2017
last
a 2019,
report
que es
of
el informe,
2017
muestra
to
que la mayor parte de
2019
los niños lo
shows
tienen
that most of
tratado
children,
con fondos públicos.
81% is treated
El
with public funds
84% se
and
trata y atiende en el
84%
sistema
is
público.
treated in the
Los
public
cánceres más
system.
frecuentes son
The most
leucemia,
frequent cancers are
cáncer
leukemia,
del sistema nervioso central y
central nervous
linfoma.
system
Las
cancer, and
regiones
lymphomas.
de mayor
The
incidencia
regions with the higher rates of
con una
incidence
mayor incidencia en Biobío,
in
Biobío
Biobío
y
region,
Atacama.
followed by the
Después de
Lake
analizar
Lagos region and
la
Atacama.
survivalidad de
When
leucemia,
analyzed
mieloma
survival of
y
leukemias
proliferativos,
and
vemos
myeloproliferative
que
syndromes,
el número de sobrevivió un
we see that there's a survival of 74.4%, including myeloid and lymphoid. Said 29%, she corrects herself, and in lymphomas, we have a survival of 91%. Of the total cases for survival is 79.5% that shows 7 points of improvement with regards to the last 5 years analyzed. And here you can see survival around 80% for both. And we compare. It's important to see that in blue, it's the first 5 years, in yellow, the second 5 years, and in gray, the 3 last years that were analyzed for this presentation. And you can see that in both sexes, there's been an increase in survival. Now, this is good, but a lot of improvement here. So we have the infant adolescent plan to take care of what we have, but also to look at a different way to this plan directed for children and adolescents, because their footprints are different to the ones of the adults. And we also want to give an approach of equity from the also a perspective of cultural diversity and gender. In that context, we have this plan where this has to be different because of the number. It would be invisible with regards to the adult. It has different characteristics and approach, especially in terms of the early diagnosis. It requires expertise and competence in infants and adolescents, which are from the PINDA, in order to achieve better results. What was our working model? Well, at the beginning, the plan was to base on the results of PINDA of more than 30 years of collaborative efforts, before to be exact, and also to do profile with this metric pool in all the PINDAs in Chile, where we did a baseline diagnosis to have our baseline and work with this WHO progressive framework. Where are we now? Where do we want to be? And how do we get there? With the technical package of the Care All World Initiative. That is how the plan has to consider cancer as WHO and PAHO considers. And that is why this Cure All package, I will talk in detail, include their advocacy, financing, and governance to decrease mortality to cancer and improve survival based on the CURE pillars, with objectives in each one of these pillars, and then indicators that will allow us as a, I thank very much PAHO for their support, and we're going to start working with this advisor. Soon is going to be working with us and working at the political and standard community and healthcare levels, where we include in this working group the health services that are in charge of the hospitals and the healthcare centers, so we can have a much more direct dialogue with those who are in charge of caring for the patient. Collect all the information based on this group, and all the objectives were included in the pillar, where we highlight the need to describe the human team that's going to work in the team, infra and equipment, the follow-up of the viral cycle, all the cancer survivals. Children and adolescents are going to become adults with higher risk, and also to include palliative home care up to 19 years. Universal coverage pillar, requesting to extend pediatric care up to 19 years of age, and to add treatment regimens for the front line, like targeted therapies or cell-based therapies or proton radiotherapy, and the evaluation of results that will have the perspective of territoriality, gender, and originary peoples, that can be interoperation between the private and sector and private and public, linked to the facilitators. And L, to have a national cancer plan with short, medium, and long-term objectives, more than 5 years. and that we had 65 experts from the civil society, academics, families, and scientific societies, and from the Ministry of Health. This drafted the objectives with a general frame, and then was shared with the Ministry of Health officers and with the national reform team, and then with experts in and outside the ministry, so you can socialize our achievements and how to obtain them. This is our model. We have this baseline with Pinda and profile. And what do we want to change from this baseline to have a better outcomes in children up to the age of 19, and how we provide the final status with the desired changes. And the idea is to measure them through indicators that would allow to have an action plan aligned and coordinated with the global vision. Today, we are in the process of drafting this, and we hope to provide this to our ministry. We would like to say in this meeting that Chile ratifies their commitment with the World Initiative Against Cancer from WHO and the Andean Ministries of Health by improving the care of children and their families. Thank you very much. Thank you, Dr. Palma. We thank you again for your commitment. Yeah. And we also invite you to remain in the room so you can answer the questions that are arriving from the audience. Now, we would like to welcome Omaira Isabel Roldan Sanchez from the Subdirectorate of Non-Communicable Diseases of the Ministry of Health and Social Protection from Colombia. Go ahead, Dr. Omaira.
No la escuchamos, doctora Roldán.
I hear you. Roldan.
Ahora sí, por favor, me confirman si ya me escuchan.
Can you hear me? Yes, we can hear you. Go ahead.
Bueno, muchísimas gracias en primer lugar.
Thank you very much to the Andean Health Organization for giving us the opportunity to participate in this event. Special greetings on behalf of our Ministry of Health and the team of the Ministry of Health and Social Protection. We're going to present, according to what has been said, the advances in challenges of childhood cancer control in Colombia. We're going to give first information about the situational diagnosis, the major advances in childhood cancer control, and the major challenges. The situational diagnosis, we have some data from Global Can, where we have estimated around 2,211 new cases of childhood cancer with children and adolescents aged 0 to 19 years. Basically, 35% are leukemias, 13.2% to Hodgkin and Hodgkin lymphoma, and 10% to nervous system. Doctor, we cannot see your presentation.
Me disculpan. Un momento.
Just a minute, please.
En este momento ya.
Sí, ya está.
Okay, you're fine now. So I was saying that among the situational diagnosis, Colombia estimate of 2,211 new cases of childhood cancer, with 35% with leukemias, 13% of lymphomas and non-Hodgkin lymphomas, and 10% of the nervous system. central nervous systems, with an adjusted incidence rate of 14.3 new cases per 1,000 population. See the trends to 20 with no important variation. In 2005, we had a crude mortality rate of 4.57. In 2020, is 4.41, with a minimal difference of 0.16. In terms of the report of cases since the surveillance system or weekly surveillance system, in 2022, we report the notification of 1,835 cases. This is the sex distribution in girls 12 to 18 years, a significant percentage and with similar distribution is 19.9 in 12 to 18 year old girls. This data are mixed up. We see that it's by the type of cancer with acute lymphoid leukemia, followed by other unspecified malignant neoplasms, followed by tumors of the central nervous system, lymphomas and reticular endothelial neoplasms, malignant bone tumors, and other leukemias among the leading types of cancer. Report in recent year improved with regards to previous year. In the pandemic, we see that the report had decreased, but in recent year, we had a better report of cases. With regards to survival, this is the Concord 3 study of the 5-year survival in 71 countries. In this country, they measure survival from 2000 to 2014. And here we can see that LLA, acute leukemia, where it was found that Colombia is in an intermediate range compared to other countries in the Americas. It has the second highest survival rate in South America with 68.9%. In a 20-year period between 1995 and 2014, it was found that 5-year survival increased by 10% or more in 14 countries, and only Colombia in the Americas, 5 Asian countries, and 8 European countries. If we see the 5-year survivor according to the National Registry, we see that in the case of the most frequent pathology, which are leukemias, lymphomas in the central nervous system, there has been an improvement in the total number of leukemias. There is a survival of 57.7%. We're still below the goal. For lymphomas, we have a better performance with 80% in 2016, and in central nervous system, we have survival over 51.9%, which is one of the lower survival in the groups of the most difficult tumors to treat, together with bone tumors and renal tumors, which have the lowest survival rate. In that context, we are going to see what has been the most important or the major advances. We have a legislative and political framework that is quite strong. We have the statutory law that was enacted in 2015 that health as a fundamental right. And I would like to highlight some of the most important laws for risk control related to cancer, such as tobacco, obesity, ban of asbestos, the healthy eating laws. We have all the components that I mentioned at the beginning in terms of the nutritional labeling and healthy lifestyle. We have 3 laws for cancer, a general law for cancer in adults, and 2 laws specific for childhood cancer. We also have a specific law for palliative care that includes pediatric palliative care. And under those policies has been policies have been generated following these laws. We have the integrated healthcare policy or comprehensive healthcare policy, which includes all the policies at the national level. And we were with this 2012-2021 public health plan that is currently under evaluation. And at this moment, we have the national public health plan that has a unique percentage of goals for the treatment of cancer from the prevention, treatment, and palliative care. We also have several participation instances and coordination for childhood cancer. There's a National Cancer Advisory Council for Children made up by representatives from government and non-government representative civil society, parents, and also territorial councils in almost 80% of the territory that are operating at this moment. Based on all these legislative and political proposals, we have built a number of tools to control childhood cancer. We have the promotion and early diagnosis. We have the clinical tool for the initial approach to childhood cancer, where health professionals and parents and caregivers have access as well as the general population. And then we have a health promotion and maintenance route throughout the course of life. In the comprehensive treatment, we have generated clinical practice guidelines and standardized protocols. Clinical practice guidelines focus on leukemias and lymphomas and specific protocols that the scientific societies have been working on in the topic of tumors. We also have specific routes for care with those. So children can be treated from the suspicious diagnosis until final treatment of cancer. And in service providers, we have 32 specialized providers. We have integrated service networks. And at this moment, one, which is the most representative, which is the Los Angeles Hospital from Pasto. We also have the special service networks for oncological services and palliative care. We recently developed mechanisms to evaluate access barriers to eliminated the need for authorizations and the payment to providers, and we have the total coverage of technologies for children with cancer. And social support services, we have a regulation for passing homes, lodging, and food that are financed by the private sector. Transportation is covered by UPC. We have palliative care guidelines, as I mentioned before, which also include the pediatric palliative care and guidelines for palliative care, and for the guidelines from the Ministry of Education for special support. And the information and monitoring systems have several sources of information, most of them included inside in the social protection general system, like CISPRO. We look at mortality, vital statistics, the regional cancer services, the CBHILA, which is the weekly notification of cases and allows us to identify children on a weekly basis. From the ministry, we have the follow-up strategy for leukemias and to identify access barriers, and we can correct any difficulties observed. We also have the high cost We have reports from the departmental councils, which is also standardized with indicators and variables, and indicators can generate risk control for cancer. And Colombia, since 2014, was supporting the clinical tool for initial approach to childhood cancer. In 2021 and 2022, we had this clinical tool for childhood cancer, which is a web prototype that has a chart for parents and caregivers that has the indicator for early diagnosis. And as I mentioned, we have a roadmap for leukemias since 2014. It has a key intervention for the primary care, for specialized care, clinical laboratories, for insurance and territorial units, and also those moments highlighted in yellow for notification of cases and confirmation of cases in the specialized unit and for the clinical laboratories. And in a study that we did about the impact of this route, we found in 2016 that the favored improvement of process within the institutions constituted in a primary element for the enforcement of rights and improve administrative processes to access treatment for children with leukemias. And since the year 2018, we are working in having guidelines for all childhood cancer in general, including hematological tumors and solid tumors. We have prioritized the most relevant in this age group. Another aspect that we would like to highlight that Colombia is already linked with the global initiative against childhood cancer since 2021. In 2021, we started this situational diagnosis and according to the special tool. And last year, together with the support of PAHO, St. Jude, and others, we start working on that action plan. A national workshop was carried out at the end of the year, where we had a large participation of the key leaders to build that action plan. And at this moment, we have in the proposal of the technical approach for the implementation of the initiative in Colombia has 6 access, prevention and early detection. In that exercise, we visualize what were the most important problems identified at the national level from the perspective of the stakeholders. And we propose activities that we are currently see how we do the implementation at the territorial level for the next 10 years. We have the goal that this is going to be in line with the being established for cancer in the public health plan 2022 to 2031. So these are the key acts that we would like to work: provision of services, human talent, access to medicines and technologies, palliative care and social support services, and the evaluation and monitoring, of course, on the form of finances linked to policies and governance and advocacy to guarantee the multisectorial effort. Finally, to finish, I will propose what are the challenges that we have in multisectorial action by seeking greater coordination of the different stakeholders in the health system, as well as an effective follow-up of compliance with health results. And we can improve with that follow-up. Another challenge is to finish the evaluation process of our cancer plan that is being done quite rigorously with and we expect to have important outcomes to relook at this implementation progress for the new public health plan, cancer. We also have the challenge of regulatory adjustment to develop and implement the preventive and predictive health model that is being projected in our country. We have another challenge of a single and interoperable health information system. As you see, we have several information sources, but it's important to have this harmonization of sources. Then we can do quick consultations for decision makers and improve the process. We also have the improve the availability of drugs and technology for cancer. And with PAHO, this is one of the alternatives to improve the process and to strengthen the spaces for social participation through these advisory councils that are operating at the territorial and district level. Once again, to thank you for the invitation, and we are ready to support this initiative so we can have better outcomes by learning about the perspective of each one of the countries and participants in these common projects. Thank you so much. Thank you, Dr. Omaira Isabel Roldan, for your presentation. And we ask you to remain in the room for the Q&A session. Now we welcome Dr. Yarenice Herrera Prieto and Dr. Priscila Maria. They are part of the Oncohematology Service of the Vaca Ortiz Hospital in the Ministry of Public Health of Ecuador. Welcome, doctor.
Ya vemos.
Ya se puede ver mi pantalla. Buenos
Can you
días.
see my screen? Good morning.
Ahora sí. Pongámoslo
Yes.
en modo presentación, por favor.
In presentation mode, please.
Perfecto.
Great, wonderful. Go ahead.
Ya. Bueno, muy buenos días con todos.
Good morning.
Es un gusto para mí tener
It's a
esta
pleasure for
oportunidad
me
de hablar
to
un
have
poco
the
de nuestro
opportunity to
país
talk about
sobre
our
nuestros
country
avances y desafíos
and our
contra la
progress and
obesidad
challenges in terms
En
of
el
cancer.
Ecuador, al igual que
In
hacía
Ecuador,
referencia
similar
doctor
to what
Sepúlveda y la
Dr.
doctora Vázquez,
Sepúlveda
no
mentioned and
tenemos
Dr. Vasquez, we don't
tumores
have a
propiamente de cáncer de
tumor
mama.
registry for
Existe un
childhood
registro
cancer.
nacional de tumores
There's a
que es
national
de la
registry of
Asociación
tumors that is
Oncológica, que es algo
carried out by the
sin
Oncologic
fines de lucro,
Institution, which is a
que
nonprofit
únicamente
organization,
responde el
but
registro de la
only
obesidad,
collects
por lo
registries in
que
some
algunos
cities.
datos pueden sesgarse,
Therefore,
algunos
some
registros
data
pueden
can be
sesgarse.
biased
Por eso
or missed.
se estima que en el año
Been
2020
estimated
más
that
se
in
deben haber
2020,
diagnosticado y por
we
eso
may have
uso esta frase porque
diagnosed,
se
and I
estima
use
que
it
pueden
been
haber
estimated because
que en el Ecuador se deben
in
haber
Ecuador,
diagnosticado alrededor de
they have
800 niños con
diagnosed
cáncer.
800 children with
Yo sé
cancer.
que
Of them,
300
300
pudieron haber sido mujeres
may
y
have
el
been
resto
women, girls, and the
estamos
rest
hablando de una edad de
boys.
0 a 14 años.
Talking about from 0 to
Como
14 years.
observando, el comportamiento en el
The
Ecuador es
behavior in
similar.
Ecuador is
Este
similar
país en
to
la
other
que
countries, with
encabeza
leukemias that being the leading,
con mayor incidencia.
the highest incidence, followed by lymphomas and central nervous system tumors. I would like to indicate the incidence of retinoblastoma in our country, which in our goals will be to consider them in the future to do a genetic study that will allow us to diagnose and why they have this unusual behavior in Ecuador. There are, Dr. already mentioned in her presentation about their projection, and it's sad to see that in Ecuador is being projected that mortality for us is anticipated in approximately 10 years from now, it's going to increase. Our country is one of the countries that has a high incidence. However, the survival is not good. For some pathologies, it's 40 to 50% survival rate. Only in leukemias and lymphoma, we can get out of high as 60 to 70%. So we anticipate that in years, coming years, we'll have more death. And this graph of mortality analyzed from 2010 to 2020, it is important to indicate that in Ecuador, the National Cancer Strategy was started was in 2018, and we see some results that have favored the decrease of these results of mortality that I already mentioned. Let's hope that with the implementation of this strategy, we have better outcomes. Similarly, we can see death to childhood cancer in the health system from March of 2020 to December 2021. It is important that this data were taken from hospital discharge. There may be some bias, that some children who did not die by cancer, but had cancer and died from other causes. Let's consider that this was during the pandemic with the highest incidence of this infection, and the public hospitals had to deal with treating all children had an oncologic diagnosis but had COVID at the same time. And at the beginning of the pandemic, some private hospitals where they saw a significant percentage of patients, most of them were derived to public health hospitals because that's where they started treating the patients with this pandemic. Similarly, the hospital discharge, considering, we wanted to show this slide to indicate that during this time, as I mentioned, the Ministry of Health treat most of these children, but all cancer patients were treated during the pandemic. The patients that were treated for cancer in health facilities, we can see that from 2020, March 2020 to December of 2022, that at the beginning of this of the 2020 year, there, despite that we were taking care of these children and the hospital was always active, there was no interruption with either outpatient or inpatient cancer treatment. However, the treatment dropouts or abandoned reached incredible high numbers. And this is something that's quite sad that hurt us and influenced in survival and outcomes. Not only in terms of access and late diagnosis, but treatment abandonment or dropout is something that we need to study and improve in order to have a better survival that we are all hoping to see. From the point of view of the legal framework, we're protected by the Constitution, where public policies are drafted that promote for the promotion, prevention, cure, and rehabilitation of health in the family, labor, and community scope. And there's an organic health law to design and implement comprehensive program during the entire life cycle. And therefore, as I mentioned before, we create the National Strategy for Comprehensive Care for Cancer. And this is the current legal standard that was issued in 2017, but was started to operate in 2018. And strategic access and action lines for National Cancer Strategy, not only for childhood cancer, but all the population, promoting healthy spaces, promoting protective factors to organize and implement a timely response for screening, detection, and specialized diagnosis, strengthening rehabilitation and palliative care for patients who have cancer at every stage. This is important. We need to potentiate for children. We don't have a center where they can be seen. In the hospital where I work in the capital city, we are recently implementing this palliative care service, but we still have a long way to go in terms of having access to medication and certain details that would allow us to operate better. The comprehensive specialized network for oncologic care and the epidemiological surveillance and research for the generation of information for the national strategy. Similarly, the target population for the comprehensive care for cancer in Ecuador is aimed to the healthy population. This is something general, not only children, but also to the early stage diagnosis and the population has disease burden. The model for comprehensive oncologic care in Peru is going to promote, in Ecuador, to promote health, screening and early detection, vaccines, timely diagnosis and treatment, and rehabilitation and palliative care. There is an allocation of resources for oncologic drugs to public hospitals. The public hospitals and the Ministry of Health, we have two that treat oncologic patients. This is the Hospital y Casa Bustamante in Guayaquil and the Vaca Ortiz Pediatric Hospital in Quito, the capital city, the hospital where I work. And last year, we had this budget. So up to a certain point, we had support from the ministry that is guaranteed with the resources for patients' treatment. The expenses for referrals, this is something that's very important because it's a reality. In public hospitals, the ministry doesn't have diagnostic tests or treatment, some imaging studies or scans or diagnosis, flow cytometry, minimal residual diseases, everything that's needed for diagnosis and treatment, also bone marrow transplant that we don't have in the public network. And for that, we have the support of the Ministry of Health, which can guarantee children whatever they require for their treatment, as well as for diagnosis and follow-up. Where are we heading to? Well, we're working in drafting common protocols with other national and international institutions, allow us to consensus and have we can all speak the same language. There's some public and private. One has different protocols. We are working with leukemias, and now we are working with most frequent tumors and with the highest possibility of cure, so we can improve survival. They're collaborative projects with other national institutions, projects in order to improve the patient's stay, helps to deal with this problem. We have the Clown Social Program. These are projects from NGOs who support the treatment and the well-being of patients. They are education and training programs for our staff. This training is sufficient to provide high-quality care for children with cancer. And these are problems from PAHO that are established by the Ministry of Public Health. These were done some time ago. We had a mandatory course offered by the Ministry of Public Health to community physicians so they can learn about the diagnosis or incentivate the early diagnosis. The updating of the national drug lists, sometimes we cannot have access to new medications. There's a lot of bureaucracy involved, but this year it was updated and we could add medication to our national formulary from which children can benefit. Our challenges were to improve the early diagnosis. It's the dream of everyone, that's why we're here. Improve the access time for timely diagnosis and starting treatment, to move ahead in implementation of the strategy for the health system in cancer, improve the gaps in oncology comprehensive care, and to draft standards for the health national system under the best available scientific evidence. This is it. Thank you very much. Just to add a couple of things that Dr. Yarenis mentioned from the Ministry of Health, we are strengthening the part of equipment, and precisely in these days we had joint meetings with all the internal offices of the ministry in order to strengthen the cancer project that we have been doing since 2019. In addition, we have restarted with training, not only for professionals who are working on their activities, but also for those instances for the rotating interns that are starting their clinical activities, as well as rural professionals who spend 1 year in remote areas and in rural areas. For us, training is very important, and that has to be done so early detection can be achieved. And we would like to thank for the support that we have by Horas CONU, and we are ready to continue in this effort. Thank you very much. Thank you very much, Dr. Yarenis Herrera and Dr. Priscila Maria, for your commitment with this effort and your excellent presentation. Now, we welcome Dr. Esi Maradiegue. She is a oncologist from the Office of Prevention and Control of Cancer and the Peruvian Ministry of Health. Go ahead, Dr. Esi. Thank you, my dear Luis. Good morning, everyone. It is an honor for me addressing you and explaining about Peru, its experience as a country following the initiative of childhood cancer in the Americas. First of all, thank Dr. Maria Carmen Calle, and also to thank you, Luis, for this kind invitation. And I think that working together, we can achieve important things. And I think that Peru, in what they've been able to develop, thanks to the support that we receive both from Horas and PAHO, research, and countries such as Chile, I think we've been able to make progress, and thanks to the commitment of the authorities from the Peruvian state. My presentation is a general overview of the progress, advances, and challenges. I have very few slides, and I hope that at the end we can have an interesting discussion. In terms of Peru, we have 11 hospitals who have pediatric oncohematology services, and we have 37 pediatric oncohematologists, one for 280,000 children and adolescents. Consider that Peru has more than 30 million inhabitants, and 1/3 of the populations are under the age of 18. We have 1,352 cases per year, and as we've been able to decrease the rate of treatment drop still high with 8.5%, and survival, according to the Institute of Metrics in city of Lima, which not necessarily reflects the real situation, we think that this is much smaller. In this, the survival is 63.7%. We have a cancer plan for adults and children, but the problem is not managed like we're going to see in the case of children. And we know that in Peru, 90% pediatric oncohematology services are centralized. The presentation is based on the technical package of Cure All that you know is based on 4 pillars: excellent centers, universal coverage, treatment, evaluation, and the 3 facilitators, which are advocacy, financing, and public policy. One of the most important progress in Peru is law called in childhood cancer law that was enacted in September of 2020, and the regulation came a year later. And this was thanks to the support, and I have highlighted we did a collective with health professionals, which started this major project, and we at the civil society, and it was so strong, so potent, that up to today it's still maintained. And I think that this goal of improving the cancer situation in Peru has been adopted by other institutions and foundations, and that gives us current in the public and political area. We have also, as Liliana mentioned, a reduction of the rate of treatment dropouts from 18.6 to 8.5%. And this was achieved with a team effort that is quite committed.
Mira, es que estoy aquí en un evento internacional del Horas con Nu y entonces me están preguntando que
Por favor, los
Could
micrófonos.
you please silence your microphones?
Te escuchamos, Omaira.
We heard you, Mayra. So, as I was saying, we were able to reduce the rate of our dropouts with 3 strategies, with organizing a committee of dropouts in the 5 or 6 most important centers for childhood cancer treatment. In addition, thanks to the PAHO support, we hire a monitor for accompanying, and she was sort of a liaison between the health professionals and the patient needs in order to be next to them and make them continue on treatment by learning about their needs. But that sometimes for these patients, they need that support, from emotional support to support with measures or basic services like food, shelter. And we're able to connect the non-government organizations and foundations who were also aware of these cases and helped us to improve these numbers. Another important aspect, and this initiative helped us to establish links. And in that regard, from the Ministry of Health, we were able to give an alliance or partnership with St. Jude, and with the support of PAHO, we could start a hospital registry that has been growing throughout these recent years, and the Office of Statistics has taken as a model both for children as well as for adults. And thanks to this type of hospital registry, we can have more efficient data, and also serves as an input for the National Pediatric Cancer Observatory, where we can show the new cases, the patients that are hospitalized, those who have died, where they come from, and is updated every 3 months. From the point of view of strengthening capacity of the health professionals, we are aware that we have a significant delay in diagnosis, and we've been working with the coordination with the Public Health National School to organize a course for health professionals in order to do the early diagnosis of cancer. Every year, we have been uh, adding models such as palliative care, and last year we added the psychosocial care, and we are planning to talk about nutrition and other topics. This type of education or training helps professionals for the timely diagnosis of childhood cancer and also offers the necessary competences in order to treat these cases and refer them on a timely basis. It also have work in promoting schools of excellence. In this picture, we are in the Cancer Institute, which is a referral center that treats most of the cases at the country level, where the team of nurses has studied on the standards for nurses' work and were able to achieve very interesting standards in complying as it is indicated at the international level and are receiving an award. And this group also carries out courses at the national or international level for the colleagues in the region. Something common that Dr. Calle on her presentation was the issue of financing. It is not possible to carry out public policy without financing, and that we learn along the way. We start with a lot of enthusiasm, thinking that the more standards we had, this was going to have a necessary impact. But when we realized that it was not just the standardization or regulation, but we needed the financing to execute all these goals or initiatives. So the pandemic hit us hard, and in terms of cancer at the national level, it put us in an area on at the side. However, we have recovered the important area. The last year, a Supreme Decree was enacted for direct transference to children and adolescents with cancer to improve their surgical treatment and to hire more professionals. And I think that this is historical for childhood cancer and something that we achieved, that the public sector budget law for this year allocated money for strengthening the detection and treatment of cancer nationwide, and also for the vaccination of human papilloma virus. We offered this vaccine initially in 2 doses, but we realized that it was very complicated, that girls in this case would receive the second dose. So that led us to update the standardization, and currently for papilloma virus is single dose both for boys and girls. So with that, we've made a significant progress in terms of public health. And also this money, approximately $125 million, are going to cover not all, but some important needs, both in terms of structure, equipment, and human resources that are needed to improve the situation of cancer at the level of the country, and therefore the situation of childhood cancer. What are the challenges? Well, I would say it's mostly to obtain financing. We have a high rotation of officials starting again and again, and a variable political situation that, of course, this affected decisions and to continue with the plans. We have a Cancer National Plan but with a partial address to childhood cancer, mostly focused on palliative care and the decentralization of services, but it doesn't address the delay in diagnosis or treatment dropouts. And also it lacked budget, but thanks to the effort that we done in recent years, we were able to improve. We also realized that the law is not perfect, that the law has an oncologic subsidy, and there was a need to propose a law so that oncologic subsidy could go to those families that are in poverty or extreme poverty. Our projects, we have the implementation of pediatric cancer registry, the professional training for early detection, to the implementation of pediatric oncohematology services in the region of Lambayeque, and the approval of the draft law of oncological subsidy, the drafting of a cancer national plan for those under the age of 18, financing for childhood cancer through a PPR program, and to develop research to see the improvement. This is not an effort of myself, but it's a joint effort with public, private, civil society institutions. Thank you.
Muy amable, doctora.
Thank you, Dr.
Doctora Esi, muy amable por
Essie.
su exposición
Very kind
y también
um,
por los retos y compromisos
for
que
the
usted
challenges
nos
and
ha
commitments
brindado
that you
para
showed
enfrentar
us
de forma
to
conjunta.
deal with them
Finalmente,
jointly.
invito a la doctora
Finally, I invite
Carolina
Dr. Ina
Copava o Copana de
Copana
Bolivia
from Bolivia
para que haga su última presentación.
for the final
Adelante.
presentation. Go ahead.
Muy amable, doctora Copana. Ya la estamos
Thank
viendo
you,
en
Dr.
presentación.
Copana.
Póngalo en
Could you
modo
put it on presentation mode,
pantalla
please?
completa. Excelente. Adelante.
Great. Go ahead, please.
No la estamos escuchando, doctora.
We cannot hear you, Dr. Copana.
No la estamos escuchando, doctora.
Hola, hola, buenos días. Ahora sí.
Good morning. Can you hear me now?
Adelante, doctora.
Go ahead.
Ok, muchas gracias. Les decía que estábamos
Thank you. I
muy
was saying that
agradecidos
we
por el
are
tiempo
very
que nos dan
thankful
para
for the
compartir con
time you
ustedes
give us
el
to
trabajo
share
que
with
seguimos
you
realizando en
the
Bolivia.
work in
El
Bolivia.
cáncer infantil obviamente es un tema
Childhood
muy
cancer
prioritario, muy
is a
sensitivo para
priority and very
nosotros.
sensitive for us.
Y bueno, ser parte de
And
esta
to
comisión
be
de
part
trabajo
of
también es
this
bastante
working
importante
commission is
y
also
estamos muy
extremely
contentos y
important.
agradecidos por eso.
And we are very thankful,
Bueno,
happy
tengo
for
del
that.
Ministerio de Salud
We're
de
from the
Deportes
Ministry of
aquí en
Health and
Bolivia
Sports, like
y
we
hemos
call it in
preparado esta
Bolivia.
presentación.
We
Les
have
quería
prepared this
compartir los avances
presentation
que hemos tenido en torno al cáncer
regards the
infantil.
situation and progress in reference to childhood cancer in Bolivia.
Voy. Ok. Para que todos tengan un poquito de un contexto más general, ¿no?
Put it in
Nosotros
a
hace
general
algunos años
context.
aquí
I
en
would like
Bolivia
to tell you
inauguramos
that
un
a few
ministerio,
years
el
ago we had
953, que es
the
el Ministerio del
951
Trabajo
ministerial
Social y
resolution where we
Comunitario.
start this national
Nosotros
program.
como una entidad, una
We,
parte
as a
independiente dentro del Ministerio de
independent
Salud,
part in the
trabajamos el
Ministry of
tema del
Health
cáncer en general,
to
principalmente
address
el cáncer
cancer in
infantil.
general, not only
Entonces es así que
childhood
iniciamos
cancer.
este trabajo
So we
en
start
el
this work
2018 más
in
o menos, ya con un
2018
presupuesto
with
mucho más establecido.
a
Antes de eso, el
adequate
tema del
budget.
cáncer se abordaba desde
Before
solamente
that,
desde
cancer was seen
desde el programa de enfermedades
from the program
transmisibles
of
como un tema
non-transmissible
más, por así
diseases.
decirlo, ¿no?
So it was one
Entonces,
more
en el año 2018
topic.
se
But
identificaron
in
algunas
2018, we
situaciones
identified the
especiales
barriers
en
for
los niños y
diagnosis
las
and
niñas con
treatments
cáncer infantil.
of
Por
childhood
ejemplo,
cancer.
que no existía
For
ningún
example, there
tratamiento
was no
regular,
treatment that
no
was free of
contábamos con un
charge.
sistema de salud
There was
universal.
no system for
Todos los
universal
tratamientos
health.
que se realizaban
So all
en los
treatments
hospitales públicos,
offered
por
in
ejemplo,
public
tenían que
hospitals
pagarse
had to be
absolutamente
paid
todos, ¿no? Por los padres
by the
y los
parents and
pacientes.
patients.
No se contaban con
We didn't
especialistas,
have
teníamos muy
specialists.
pocos
We had very
pediatras
few
o muy pocos especialistas que podían abordar este
oncopediatrics
tema
that could
dentro de los hospitales.
treat these
Tampoco
patients.
teníamos muchos hospitales,
We
hospitales con atención
didn't have a
especializada,
hospital
¿no?
with
Habían
specialized care.
muy poquitos servicios que
Very
estaban
few services
elaborados, que estaban
that
listos para poder
were
atender a
ready
pacientes con
to
cáncer
treat
infantil.
patients
Y
with
tampoco
childhood
contábamos con un
cancer,
registro de cáncer
and we
infantil, ¿no?
didn't
No
have
había un dato
the
estadístico, no existía la
childhood cancer
información.
register.
Entonces, en este año 2018
So in
estábamos en esta
2018,
situación
that was
para
the
que todos podamos
situation.
tener un contexto general
So we
de la
can all
situación
have a
de cáncer
general
en Bolivia.
context of the situation of cancer in Bolivia.
Voy. Entonces, haciéndoles un poquito de información de los antecedentes,
Well, in
pues
terms
a
of
partir
the
de
history,
2019
in
se da un
2018 and
importante esfuerzo para
2019,
poder
the Ministry of
enfrentar este tema,
Health,
¿no?
in order
Se
to
destinaron
address
recursos
this
económicos,
issue,
ellos les tocó
allocated
justificar
economic
porque se habían destinado a este
resources,
motivo alrededor de 2.200.000
around
bolivianos
2.5 million
destinados a comprar
Bolivianos
medicamentos
that were
necesarios
used to
para las
buy
quimioterapias de los niños. Y
chemotherapy.
como aquí en Bolivia tenemos
And
3
because in
departamentos de
Bolivia we
salud
have
que
3
se consideran
departments of
emergentes,
those
¿verdad?
9,
Cochabamba, La Paz y Santa
that
Cruz,
Cochabamba, La
donde
Paz, and
tenemos
Santa
hospitales
Cruz,
de tercer
where we
nivel
have
donde hay
third level
pediatría
hospitals
y
where they have pediatric
oncopediatría,
services and also
entonces se destinaron
oncopediatric
estos
services.
recursos para
We
poder
allocated
ingresar
these
a comprar
resources
medicamentos.
to purchase
Asimismo,
drugs.
se promulgó el decreto
We
supremo
also, with
3704, ¿no? En el
the
año 2018. Este fue
3704
un
Supreme
hito
Decree,
realmente en la historia
this was a
del país,
milestone
¿no?
in the history of the
Pudimos
country.
garantizar con este
We could
decreto que
guarantee
tanto
with
pacientes
this decree
adultos como
that
niños
both
puedan
adults and
recibir
children
tratamientos
patients
de
could receive
radioterapia, por ejemplo, sin costo
radiotherapy
alguno.
treatment, which are of
Ojalá
high
teníamos
cost.
solamente
Here
centros de radioterapia
we
en sector
have
privado, donde están
radiotherapy
afiliados a la
centers in the
seguridad social,
private sector or
pero
social
son
security
costosos, muy
that were
costosos para
very
que los
expensive.
pacientes y los padres de los
So
niños
that
puedan
patient and their
accederlos. Entonces,
care,
este decreto
parents and caregivers
fue
could
un nuevo
afford.
esfuerzo que se dio para
So
poder
this was a
garantizar
first step
tratamientos de alto costo en el
towards
tema del
high
cáncer
cost
infantil.
treatment for childhood.
El año 2019
In
se promulga la
2019,
ley
the
1152, justamente el
law
2019,
1152
y
was
esta
enacted
semana se
on
inicia en el
February
país en
20,
el tema de salud, ¿no? No
and
solamente como cáncer,
we
sino
could
que
see that
se promulga el Sistema Único de Salud, el
there
famoso
was
SUS,
the
quizás algunos de
SUS,
ustedes lo
the
escucharon ya,
unique health
y con
system,
esto se quería tener y se
and with this
quiere
we
tener un sistema de
who
salud
want to have
gratuito,
a
universal,
then that's
para
free of
garantizar
charge,
salud a todos,
universal to guarantee
trabajando
health
en un seguro
to
privado
everyone who
o
has
con un
have a
seguro
private
de la
sector
seguridad social.
or are not
Entonces,
members of the
uno de los
Social
principios de
Security.
esta ley era
So
el
one of
tema
the
de la
principles of the
progresividad,
law was
donde
progressivity,
se menciona que la implementación iba a
that
ser
the
gradual y
implementation will
progresiva.
be gradual and
Entonces, en
progressive.
2019
So
estamos en un programa
2019,
nuevo, ¿no?
we had a
El
new
Programa Nacional de Cáncer, donde
uh,
estábamos ante
look,
la realidad en la que
and
teníamos
we were
que
facing a
garantizar el
reality
tratamiento
in
de
we
los
need
niños
to
y
see how we
niñas,
were going to cover
sea a través
treatment
de
of
estas
children that were free of charge,
experimentaciones
that
cada
was
vez
more
más
accessible
acertadas,
and do
pero sobre
better
todo
and
en
earlier
este
diagnosis.
momento que los niños
But at
puedan
that
tener
moment, the children
acceso, ¿no?
could
Puedan tener
receive
tratamientos
care and
y puedan
treatment,
tener muchas más opciones de
could
sobrevida
have more
y tener una
options of
mejor calidad de
survival
vida
and
sobre
a
todo,
better
¿no?
quality of life.
Entonces ahí les hago un pequeño resumen
So there's a brief
y ya para
summary of what
finalizar con el
we
Sistema Único de
you have
Salud.
included
La
in this
radioterapia, le hemos puesto con sedación
system. We
instrumental en
have
niños bolivianos,
radiotherapy with
las
sedation,
quimioterapias,
required
las cirugías
chemotherapy,
oncológicas y los
oncologic
estudios e
surgeries,
investigaciones
and
complementarios de
complementary
diagnóstico y
studies and tests
tratamiento
for diagnosis and
oncológico
also
y de
palliative care
tratamiento en el
are
sistema
currently
único de
included
salud.
in the
Vale decir que todos los niños que
Bolivia's
asisten y
unique
acuden a
health
los
system.
hospitales públicos
So
pueden
every
tener
child
estos
who comes to a
tratamientos
public
de
hospital
gratuidad.
can get this
Obviamente, cada
free
ministerio donde
treatment.
echamos mano del
And of
privado
course,
lo
of the
hace de manera
ministry, we
oficial para
also
beneficios
use
de todos,
private
¿no? Porque
sector
todavía los
and
proyectos del sistema
um,
público están
social
en
security
ejecución.
because
Pero
some of
como
the
base
public
el
sector is
sistema
still
único
under
de salud lo
implementation, but
ofrece
however,
con gratuidad.
the
Quiero hacer referencia a
unique
esto porque como
health
país somos
system
muy
is covering all the
nuevos en esto
expenses.
y
We as a
somos
country are new in this.
de
There's
4 años,
only
3 a 4 años
3 or 4 years of
avanzamos
this
demasiado,
effort,
entonces muy
and we think
desconocemos
that we
sobre este
gain
tema.
major steps.
En la gestión 2021 y
In
2022 se
2021 and
destinan
2022, we
aproximadamente más de
allocated
22 millones de
22
bolivianos
million of
para todo esto que les
Bolivianos
menciono,
for
¿no?
everything that I just
En la
mentioned.
gestión 2019 la
In
inversión se
2019, the
proyectaba de 2
investment
millones a 3 millones.
was
Entonces,
2 to 3
el
million.
tema de la
So
priorización que está
the
haciendo la región y el gobierno
prioritization that the
se
central
refleja en,
government is
en la
reflected
inversión de los recursos
in the
económicos,
investment
¿no?
of economic
Y este
resources.
2023
And in 2020,
proyectado alrededor de 14 millones
projected 14,248,000 Bolivianos for this care. This is always in terms of how hospitals allocate resources and use them. But we as a ministry have the responsibility that the resources are better used. In some of the previous presentations, I saw that there's a common factor are the targeted therapy, monoclonal antibodies, or state-of-the-art treatments. Those medications are not yet included, but we need that the resources that the country invests can be optimized and improve the investment. We have the resource, but we need it to come and be better management. And here you can see that with the beginning of the years, as a country, we are working to improve the treatment of cancer, especially in children. A very sensitive and important topic for all of us. The progress in terms of the Cure All initiative, as has been mentioned by many of the previous speakers, and I have Liliana Vasquez here. On February 14 of this year, we had the opportunity, as you can see in this picture, to meet all the pediatricians of our country and the department services, and we validated the guidelines of the timely diagnosis of childhood cancer. And this is very emotional for me because in our country, this is the first standard that we have with regards to childhood cancer. There was no previous anything such as this, and we have celebrated with the entire team. We've been able to discuss, drafted, and agreed with consensus of this project with support of WHO and PAHO through Liliana and the people who support us. And we have a validated document that we need to follow administrative steps for their publication with a ministerial resolution. And this has been very useful for that step. In the progress that we made, I would like to report that the country is making efforts in organizing the hospital committees for specific committees for childhood cancer. There's a committees for registry, for treatment follow-up. And since 2021, we've been working with a diagnosis and we are making progress thanks to support from PAHO. We also have a protocol for treatment of leukemias and it's under validation phase. Our cancer register, as I mentioned, we made an effort to collect information from all sources. Initially, we worked with a population-based registry. Now, considering how we're going to deal with this information is what has been collected from public hospitals, private hospitals, social security hospitals, with an anatomy, pathology reports, admissions, deaths. So the results are these ones. We have new cases of childhood cancer in Bolivia of 2,259 cases in the last 5 years. And as you can see, we have a mean between 400 to 450 new cases that are diagnosed. We are involved in all types of cancers. And this is the general database that has been in, and we need to publish this and make sure that the data as a country are present in all the international registers. The types of diagnosis of childhood cancer, the most prevalent are those in bone marrow and the primary location. So we have leukemias followed by the world trend. 38.8% of diagnoses are in this primary site. In second place, we have lymphatic lymph nodes, so this is lymphomas, followed by bone cancer, followed by the central nervous systems, and the ones that you can see in that chart the information that we have for now as a national program.
Bueno, dentro de todos los
Well,
desafíos que
among all
tenemos
the
como
challenges that we have
obviamente
as a
tenemos
country,
mucho trabajo que
we
hacer
have a
por
lot of
delante,
work
¿no?
to
Como
do.
les decíamos,
As I mentioned,
el programa es nuevo, se han hecho muchas
this is a
cosas
new
hasta el
program.
presente, pero obviamente necesitamos
We
trabajar
still
y
need to
necesitamos ser
work
realmente con mucha prioridad en este
with
tema.
a lot of
El
priorities.
primer desafío que yo
The
les
first
mencionaba
challenge
era
that
la
I can
disminución de la
mention is to
mortalidad y
decrease
hacerlo con más calidad
mortality
de vida, ¿no?
and have
Para lo cual vamos a
greater
necesitar todo el
survival. And for
apoyo
that, we are going to
interdisciplinario.
need interdisciplinary
Hablo mucho de
support,
la mejora de los sistemas de salud en
improve
todos los
health
subsectores,
systems in all the subsectors,
obviamente con todas las redes de atención que
because with
tenemos en
all
el
the
país.
care networks that
Necesitamos
we have in the
nuevamente
country, we need to
modernización, todo lo
improve
que es el tema de equipamiento, el
infrastructure,
tema de
equipment,
gestión de recursos humanos. Estamos
human
hablando de una
resources
etapa muy
training. We
complicada
still
en
are a
este
very
contexto.
complicated area
Otro de los
in the
desafíos
country in
importantes
this
es
regard.
la complementación
Another
de la
important
formalización del
challenge
marco normativo, ¿no?
is the
Como les decía, está en
formalization of the
cumplimiento,
normative
tenemos una
frame.
guía de diagnóstico
We have a
precoz y
guidelines
preventiva
for timely
que está
diagnosis, which is
normativa
our
como
first
país.
standardized
Después también
document.
estaremos trabajando
And
en
also
elaborar
we're
nuevos
going to be
protocolos
working with
uniformes como
protocols,
país, ¿no?
standards.
Otro de los desafíos importantes
Another
es la
important
operatividad de la
challenge
guía de
is
diagnóstico que
to
les comento, ¿no? O sea, tenemos que hacer que eso llegue a todos los
work these
subsectores,
early
a los niveles
diagnostic guidelines, be
inferiores de
operative, and reach all the
administración, todo el
levels of
tema
healthcare
del
so
diagnóstico oportuno,
physicians can talk
reconocer
about the
síntomas
timely
y
diagnosis and recognize the
chicos puedan
signs and
ser llevados
symptoms
para una
so
atención
children can be referred
especializada.
for specialized care on a timely
La reunión
basis.
de la mesa de cáncer infantil a
The
nivel nacional anualmente es una de las
setup of a
metas que tenemos, porque
childhood
obviamente
cancer
podemos sentarnos aquí todos,
roundtable
pero en la foto no
as you
somos muchos en
so
Bolivia,
we are not
pero
very many
necesitamos
people in Bolivia who treat
necesitamos reunirnos y trabajar
cancer,
juntos, que es uno de los retos
so we need to
que
work
tenemos.
together.
La evaluación de la
The
implementación del sistema
evaluation
de
of the
registro
implementation of the
hemos,
registry
hemos
software.
estado trabajando en
As I
este
mentioned, we have been
proyecto y
working
necesitamos
for the
evaluarlo
registration, but we need to
orientalizado
evaluate the
para
work that
poder
we have
proyectar un
been
mejor
done
trabajo en cuanto al
to
futuro, ¿no?
improve this in terms
La
of the
implementación de
registry.
comités de cuidados
Implementation of palliative
de
care
cuidados
committees.
intensivos igual la necesitamos desarrollar mucho,
We
¿no?
also need it needs
En el
to be
tema
developed
de las leyes, de las
in
normas,
terms of laws and
nosotros
acts.
contamos actualmente como
We
país con la ley
currently have
1223 de cáncer que
law
promulgó el año
1223
2019,
of
pero
cancer was
aún
enacted in
estamos trabajando en el
2019,
tema de su
but still
reglamentación.
working in
Es
its
muy complejo y
regulation.
como
It's
país
quite
hemos
complex.
enfrentado muchos
Country,
desafíos estos
we
últimos
have
años,
faced many challenges
tanto
as
en
a
el tema de
country,
gobiernos
government changes or
y
government,
cambios que muchas
and
veces
these
perjudican
changes
bastante, pero estamos
sometimes
trabajando en eso. El
affect
Plan Nacional
us
de Control del
negatively.
Cáncer del Estado
The
Plurianual de
National
Bolivia, que está
Plan
programado para la
for
gestión
cancer control for
2023-2028, se encuentra en elaboración.
2023-2028
Entonces,
is being drafted.
tenemos ya un primer borrador que lo
We have
estamos
a first
trabajando y lo
draft
estamos
that's
sacando
been
adelante. Obviamente, el plan
worked.
nacional no se trabaja solamente
A
como
national plan
ministerio,
can
¿no?
be worked as a
Necesitamos articular
ministry.
algo mucho más
We need
grande
to coordinate something
y
large
que es de conocimiento de ustedes que se está haciendo, ¿no? Y
to
bueno,
let you
he
working on
escuchado
it.
también en algunas
And
ponencias
also
el tema
heard
del
in some
trasplante de órganos.
presentations,
Nosotros
we
como
talk
país
about the
todavía
issue
no
of
hemos
transplantation.
iniciado, por ejemplo, el
We
tema
as
de
a country have
trasplantes
not started
alogénicos para el tema
the
de la leucemia
allogenic
y se está
transplants for
trabajando también en
leukemias.
implementar un
We're also
protocolo
working in the
internacional
implementation of a
en
national program
trasplantes tanto de
that
órganos
deals
como de
with
células.
the
Esperamos
transplant of
iniciarlo para
organ
que ya
tissues and
pueda
cells, and hopefully
empezar a
this
trabajar
program
para
can
que se
start
pueda darle
operating
mejor el tema de la red, de
so
la
we can
normativa
talk
y el
about
futuro desarrollo
referrals,
también en
networks,
este tema
and
de
standards
trasplante. Así
for
que es
transplant.
un gran desafío que tenemos
So this is a
a nivel
major
país.
challenge that we have.
Bueno, les
Well,
muestro lo último
show you
que
the
hemos
final
trabajado
slide.
como ministerio, ¿no? Quería una vez más hacer
Once
referencia a la
again, I would like
inversión
to
que
indicate
lo
the
que obviamente
investment being done,
necesitamos trabajarlo y
but we
todo,
need
hacer que
to
esta
work
inversión sea
together
sostenible
so this
y
is a
que
sustainable
las
investment
niñas en Bolivia puedan
and the
tener
children
mejores
in
días
Bolivia can have
cuando
better
hagamos este
days
diagnóstico,
when
¿no?
we talk about this diagnosis.
Y bueno, eso es lo que yo quería
This is
compartir
what I wanted to
desde el
share
Ministerio de Salud de
from the
Bolivia.
Ministry of Health of
Obviamente siempre
Bolivia,
prestos a
and
que
of
podamos
course,
seguir
always
coordinando y
ready to
agradeciéndoles siempre
work
por el
together
espacio
and
que
thanking
nos
you
dan
for your
para
support and space
nuestra
to
información.
give us to share
Muchas gracias.
our information as a
Muy
country.
amable, doctora
Thank you very much.
Copana, del Ministerio de Salud de
Doctor,
Bolivia.
very much. Thank you very much.
Agradecemos su compromiso con este trabajo y
Your
luego
commitment with this
invitamos a
effort,
quedarse
and we invite you to
para el
stay
último momento
in
que
the room
se relaciona a las consultas que están haciendo todos los países.
for some of the questions
Quiero
that are arriving.
hacer énfasis
I would like to
en este
emphasize
momento
that at this
hay
moment we have
conectados
connected
varios países,
several
empezando
countries,
por Bolivia,
starting with Bolivia, Chile,
Colombia,
Colombia, Cuba, Ecuador, Guatemala, Mexico, Paraguay, Peru, Paraguay, Venezuela, and with each one of the ministries of health of the Andean countries. We also have this, the health office of Fusagasugá from Colombia. Thank you very much for your participation. It's important also to mention we received many greetings for the presentations, for the data analysis, prevention, detection of childhood cancer. And there's a very interesting comment that I will make at the end of the presentation. So we invite all of you to start your videos so we can do the final portion of this program.
Bueno, comenzamos con la primera exposición a cargo de la doctora María del Carmen Calle y también la primera.
We start with the first question for Dr. Maria Calle. What do you consider are the most important opportunities of Andean countries to reduce the incidence and mortality of childhood cancer? Go ahead, Dr. Calle. I think that the most important opportunity is that everybody doing progress. There's progress made at every level of Andean Health Organization. The Cancer Committee is made up by focal points that are appointed by the Ministry of Health. That there's been a joint effort for the generation of this program, for the generation of this policy. Now, I do believe that the implementation plan and in a way that is special for the comprehensive care, and definitely we include everything else. But my opinion is that there has to be an Andean plan for the integration of childhood cancer, specifically for childhood cancer. On the other hand, what opportunities do we have? And we have partnerships. We're not alone. I think that we have PAHO, we have St. Jude, we have ORAS, we have the ministries, we have the civil society. There's a lot of institutions dedicated to this. And we know that the priority topic is the early diagnosis and timely treatment. Because we're not going to prevent cancer in children. What we need to do is to do adequate diagnosis and treatment to decrease mortality and to increase survival. And I think that there is an opportunity because they're very important experiences that we as Andean countries can share and improve. Now, there's something that I've been looking in the questions and comments, that a lot of clinical information. This has been a webinar of telling us how we're doing in terms of progress in childhood cancer in our countries.
Hago la promesa formal.
Well, I do the formal promise that soon we will have a webinar in which the approach is going to be clinical, because we really need that. Because in order to increase, I'm going to take the opportunity to mention that we need to increase the opportunities in this early diagnosis. We need to think in type of audience. The first audience are professionals, those who are in the first level. We know that there are tools such as PAHO courses, but we know that those courses, when are done together with Oraconu, are not tools, self-application, but they need advisors in this topic. And soon we're going to set up, and we had the experience with mental health and other topics. The other major group is the population at large. If the population has no idea of when to suspect, what are the alert signs, when do we have to be concerned? There's no way that they can come to visit the doctor, doesn't know how. We have to use this material communication that are going to be posted in horas. We need to look for spaces quickly and do this dissemination. Another opportunity that I see is that childhood cancer is a very sensitive topic. We're talking about children. And I really enjoyed what St. Jude mentioned. It's not fair that children don't see another dawn. It's not fair when there are. I have friends in the US who deal with oncology in survival, and they have nothing to do with survival that we have here in the Andean region. So I think that there are opportunities, and we're working together. I think that is the most important. Thank you, Dr. Calle. There was a second question related to who participated in the drafting of the Andean policy for prevention and control of cancer and the priorities. Well, this is an opportunity that I forgot to mention. That November 25th, the ministries signed the plan, the policy and the plan in the committee. And that was their decision, because we need the highest level decision. And another opportunity is that we are negotiating prices with the 6 countries. And the 6 countries have put in first place oncological drugs. We're not negotiating prices. We have the strategic fund from PAHO, we have UNICEF, and we are considering how to obtain better prices. Who made up the committee? The committees are made up by professionals who are appointed by the ministries of health. And the professionals of health start drafting an output or a document, and the output is the consensus of those 6 countries. This is evaluated after the presentation of the policies, evaluated by our technical committee, evaluated by the ministers, because they don't sign something that they have not evaluated. And this policy precisely has been made official in a resolution of November 20. Thank you, Dr. Calle. I would just like to add that there was the official participation of all the focal points, our specialists in terms of cancer, appointed by the Ministry of Health, who achieved with this working group that started last year to work consistently and make progress with the resolution mentioned by Dr. María del Carmen Calle and be in the technical committee. This is the working group drafted the proposal, but now looking at the relevance and importance given to this topic of cancer, a committee has been appointed and they are officially representing each one of their countries. The second element is that through a consultancy they have been building each one of the components of the specialists to which we thank from the Andean Health Organization in coordination with PAHO. A proposal been drafted, and this was approved at the end of last year. So it has a recent birth because each one of the countries has been making progress in different lines and different levels of progress, but now it's going to be jointly as Andean countries included in a major plan related to fighting against non-communicable diseases, where we have cancer, cardiovascular diseases, diseases such as diabetes and complications, and also chronic respiratory diseases, part of a whole, and this is one of the components, very sensitive. And from Dr. Maricarmen Calle has received an important trust to face childhood cancer as one of the reasons to be reduced. Thank you very much. And this concludes the interpretation into English. Bye-bye.
De salud mental en los niños con diagnóstico de cáncer infantil se han identificado en el trabajo en conjunto que se viene realizando con los países de la subregión andina. Adelante, doctora Liliana.
Muchísimas gracias, doctor Bengolea, por la pregunta. Y realmente es muy relevante hablar de salud mental, sobre todo en este escenario post-pandemia, ¿verdad? En que hemos aprendido muchísimo. Para la experiencia que hemos tenido durante estos últimos meses, probablemente entre el grupo de colegas, el grupo de expertos que conforman este equipo regional de cáncer infantil, es que la salud mental y la atención psicosocial no debería ser un lujo, no debería ser algo inalcanzable para los países que conforman, sobre todo la subregión andina, en donde hemos visto que se han visibilizado mucho la necesidad de trabajar en ese tema. No debería ser un lujo, pero muchas veces se desplaza la atención salud mental y la atención psicosocial justamente porque hay muchas otras prioridades más emergentes, la atención específica del cáncer, la falta de medicamentos, la falta de un apoyo quizás de un sistema de salud que esté organizado. Entonces, para nosotros, bueno, una de las experiencias más bonitas fue poder comprender eso, que es parte de un equipo multidisciplinario que atiende al niño con cáncer, no solamente el psicólogo, la psicóloga, la psiquiatra, ¿verdad?, que atienden los niños con cáncer, sino es todo el equipo realmente que conforma estas unidades de atención de los niños, empezando por los médicos, las enfermeras, las asistentes sociales, los mismos familiares, por supuesto, quienes son la parte vital del soporte del niño cuando está pasando por esta difícil etapa de tener una quimioterapia, de tener una radioterapia, etcétera. Los hermanos, un tema muy importante que muchas veces se deja de lado porque la familia atiende principalmente al niño y muchas veces se olvida de que hay 1, 2 o 3 hermanos que también necesitan atención. Entonces, esto desde nuestro trabajo, digamos, el trabajo que se ha hecho en la región ha sido un aprendizaje muy bonito y ha podido lograr concretarse en una serie de documentos que yo les invito a que lo revisen o si pueden googlear como Atención Psicosocial Cáncer Pediátrico en OPS. Y es una serie de 6 hojas informativas muy concretas, ¿no? Cada una tiene entre 8 y 10 páginas, pero que hablan cada uno de esos puntos. ¿Cuáles son los requerimientos, los criterios mínimos de atención psicosocial y salud mental para los niños con cáncer? ¿Cuáles son las atenciones mínimas que se debe tener durante la quimioterapia, durante la radioterapia, después, antes de una cirugía? ¿Qué consideraciones tener con la familia de un niño con cáncer, los hermanos, los padres, quienes también, hay un módulo muy bonito que habla del cuidando al cuidador, porque cómo uno puede cuidar a otra persona cuando su salud mental está tan pues venida a menos por alguna tragedia como es tener un hijo con esta enfermedad tan trágica. Entonces, cada uno de estos módulos nos introduce un poco a esta perspectiva de que es necesario hoy tener esta atención psicosocial y de salud mental en los niños con cáncer. Y agradecer mucho a los equipos que ayudaron a conformar a este grupo, este manual. Vamos a lanzar también próximamente un curso específico para profesionales de la salud que hable sobre la salud mental y la atención psicosocial de los niños con cáncer. Y bueno, yo no quería dejar pasar la oportunidad de felicitar a todos los equipos que han presentado el día de hoy de los países andinos, porque realmente es muy emocionante ver que las autoridades en salud, que los equipos tienen como prioridad ahora la atención del niño con cáncer en los países, y rescatar sobre todo las palabras de la doctora Calle, que estamos avanzando, la doctora Copana, que estamos saliendo adelante, y yo creo que es más productivo cuando lo hacemos juntos. Así que muchísimas felicitaciones y agradecer al organismo regional andino siempre por su apoyo.
A usted, doctora Liliana, que siempre está atenta a los requerimientos de todos los países y también a trabajar en conjunto. Nos encanta el buen deseo de trabajar unidos, y eso da un plus que es importante a nivel de nuestras instituciones. Muy amable, doctora. Seguidamente a la doctora Patricia. ¿Qué retos con relación a la prevención y control del cáncer infantil en la región andina vislumbra a futuro?
Gracias, Luis, y gracias a todos, y vuelvo a felicitar. Los retos creo que son los que ya se vienen mencionando, es llegar a la prevención y al diagnóstico, en este caso en el cáncer infantil, del diagnóstico temprano de los signos y síntomas, y creo que vislumbro que, como está la curva en la colega, estamos confiados que va a bajar la mortalidad y podremos concretar esta política, pero no lo vamos a poder hacer solos, sino creo que este es el escenario ideal, en equipo, todos los actores, sociedad civil, estados, gobiernos, instituciones privadas. Creo que es la manera de poder llegar a un resultado efectivo, actuando sobre el primer nivel de atención, que creo que son las primeras puertas de entrada de todo lo que es la agencia sanitaria, y esta oportunidad, que son lo que presentaba yo, la cooperación horizontal, los proyectos SHD, que son fondos para fondos semillas, para futuros proyectos. En este caso creo que va a ser muy promisorio, y vamos a incluso sumar más fondos de otros donantes.
Muy amable, Patricia, por tus palabras. También estamos muy contentos de trabajar con el SAM, y tenemos muchas metas para construir o para resolver, para llegar, para contribuir también. Esperemos que el financiamiento Semilla pueda brindarnos la posibilidad de impulsar las iniciativas que estamos teniendo en forma conjunta. La doctora Julia Palma se disculpaba con todos nosotros. Está ella muy comprometida, y así lo hizo, de conocimiento, que seguirá bregando conjuntamente con todos para sacar adelante los productos que ya hemos pensado. La doctora Julia se disculpa con todos los presentes, pero va a seguir contribuyendo. La doctora Mayra Roldán de Colombia tiene una pregunta. Dice: Colombia se caracteriza por ser uno de los países de la región andina con mayores avances en salud digital. ¿Qué avances específicos en este ámbito y en relación con el cáncer infantil se han logrado, y cuáles quedan pendientes en el país? Adelante, doctora.
Sí, buenas tardes. Gracias por la pregunta. Pues Colombia está trabajando en precisamente la historia clínica interoperable. Digamos, es uno de los temas que se han venido trabajando en el último quinquenio, y recientemente pues ya se expidió toda una reglamentación con respecto a esto. Tenemos varios sistemas de información en línea para, por ejemplo, el tema de medicamentos que no estaban incluidos en el plan de beneficios, que están excluidos por alguna u otra razón y que son financiados por el Estado, que no lo está en el aseguramiento. Entonces, esos sistemas de información digital pues nos permiten agilizar muchos procesos administrativos para el acceso a las tecnologías en salud. Tenemos también en línea varios sistemas de información, por ejemplo, el de notificación obligatoria al Civigilia, que también está en línea y permite tener información semanal de los casos sospechosos y de los casos ya confirmados de cáncer infantil, y nos permite pues que todas las entidades territoriales monitoricen la atención de los niños con cáncer, midiendo pues unos indicadores de oportunidad, al acceso al diagnóstico, al tratamiento, etcétera. Entonces pues son sistemas que nos permiten agilizar, digamos, todo el proceso de toma de decisiones y también de operación para mejorar pues el acceso a los servicios de salud.
Muchas gracias. Bien, continuamos con las preguntas. Y aquí tenemos una para el equipo de Ecuador. Para la doctora Berenice y la doctora Priscila María. Como resultado de la Estrategia Nacional de Atención Integral del Cáncer en Ecuador, ¿cuáles son los principales avances o experiencias significativas en investigación de cáncer infantil en Ecuador? Adelante, doctora Berenice.
Bueno, yo prefiero que Priscila me ayude con esa respuesta, porque como ella está directamente en el Ministerio de Salud Pública, yo creo que ella va a dar una mejor respuesta que yo.
Sí, muchas gracias. Bueno, con respecto a este tema, nosotros como Ministerio de Salud Pública se están obviamente activando convenios con algunos de las universidades de aquí del país con la finalidad de fomentar la investigación en todos los cánceres y obviamente enfocado también en el cáncer infantil. Actualmente estamos retomando todo lo que es la parte de la normativa, inclusive para poder consolidar en cuanto a las investigaciones específicamente. Adicional a eso, una de las primeras investigaciones que no solamente está enfocada para el cáncer infantil, sino para todos los cánceres, es una investigación enfocada a costos reales de cáncer que se la está lógicamente realizando con la finalidad de tener una visión obviamente real de todo lo que implicaría tener un presupuesto ya definido para el accionar desde la promoción hasta el diagnóstico precoz y el tratamiento de todos los cánceres, incluido el cáncer infantil.
Gracias, doctora Guevara. Y bueno, finalmente la pregunta para la doctora Eisi Maradiegue de Perú. ¿Cuáles son los avances puntuales y retos pendientes en la reducción del copago de las familias de niñas, niños y adolescentes con cáncer? Adelante, doctora Eisi.
Muchas gracias por la pregunta. Bueno, nosotros elaboramos una propuesta de subsidio oncológico para estas familias que están más afectadas, digamos las de pobreza y pobreza extrema, y ese documento se encuentra en evaluación en el Ministerio de Economía y Finanzas, porque la idea era presentar un proyecto, digamos, con un sustento técnico a fin de que pueda ser evaluado y también que pueda ser aprobado por el Ejecutivo, digamos, ya con un presupuesto. Entonces, desde esa perspectiva, esa propuesta ya está elaborada. Esa propuesta también indica de que el seguro integral de salud, que es el seguro que cubre a estas familias, pueda asignar ese presupuesto. Y una buena noticia ha sido que en la semana anterior ya ellos han realizado una solicitud de demanda adicional para obtener ese presupuesto. Entonces yo creo que con eso, si ellos pueden, digamos, aprobar el presupuesto, me refiero al Ministerio de Salud para este seguro, ya tendríamos financiamiento para poder cumplir con esta propuesta de ley y el paso siguiente sería la aprobación, ¿no? A través del Ejecutivo.
Muy amable, doctora Esi. Bien, estimadas y estimados presentes, como ustedes han podido apreciar, este webinar ha sido muy especial en el sentido de que ha abordado el tema de conducción sobre el tema principal de cáncer infantil, conducción y gestión. Va a haber un momento, y gracias a los comentarios que han puesto, donde se pondrán los temas que los atraen también relacionados al aspecto técnico, médico, quirúrgico, etc. Quiero reiterar una vez más el agradecimiento a nuestros excelentes ponentes y a todos los asistentes que semana a semana nos acompañan, igualmente al equipo del Organismo Andino de Salud y a todos los que participan en esta actividad, que ha sido posible gracias al compromiso con la integración andina y latinoamericana. Cedo la palabra a la doctora María del Carmen Calle, secretaria ejecutiva del Organismo Andino, para el cierre de este webinar en nombre de la institución. Adelante, doctora Calle.
Gracias, Lucho. Bueno, mis primeras palabras son de agradecimiento a todos los ponentes. Qué casualidad, todas las ponentes hemos sido mujeres, no sé si se han dado cuenta. Moderador ha sido hombre y Hernán y el doctor Mas han sido hombres, pero ¿no? Han sido hombres, pero todas las que hemos expuesto han sido mujeres. ¿Por qué será? No lo sé. Pero lo concreto es que el cáncer infantil sí se puede curar. Y ahí están los números. Las grandes diferencias se deben a en qué país se vive uno, ¿no? Y digamos si hay posibilidades o no de hacer un diagnóstico precoz. E iniciar el tratamiento, no solo es el diagnóstico precoz, hay que iniciar el tratamiento correcto, ¿no? Todo eso tiene que suceder. Y para eso necesitamos seguir aunando esfuerzos. Yo creo que este ha sido un webinar muy, muy productivo. Ya mientras ustedes estaban exponiendo, ya nosotros por WhatsApp nos hemos puesto de acuerdo en muchas cosas. Así que yo creo que esto ha sido muy productivo. Les cuento que el Comité Andino de Cáncer se va a reunir probablemente en mayo, y en mayo va a ser el tercer o cuarto comité ya que se comienza a reunir presencialmente, y lo vamos a hacer en Chile. Y definitivamente no va a ser, el tema obviamente va a ser cáncer, pero vamos a dedicar un tiempo, digamos, un tiempo pertinente al tema de cáncer infantil. Obviamente contaremos con la presencia pues de LORAS, de OPS a nivel Washington y de OPS a nivel SAM. Ya veremos cómo hacemos lo del comité, pero esa es una cosa que la tenemos planificada desde el año pasado, hacer una reunión del comité de cáncer. El segundo tema, sí, vamos a comenzar con un curso, pero con asesores, eso ya lo ponemos de acuerdo. Ya nos ponemos de acuerdo con Liliana, con Lucho, cómo lo vamos a hacer, pero definitivamente queremos... Yo no creo mucho en las cascadas, discúlpenme, yo soy medio malosa en eso de que yo te enseño a ti, tú le enseñas al otro y el otro le enseña. A mí, francamente, mientras yo le enseño al otro, al final queda otra información. Entonces, lo que sí necesitamos para ese curso es gente que atienda pacientes. Nos encanta que vayan los directores, nos gusta que estén los coordinadores, porque al final ellos van a mover la parte política. Pero lo que necesitamos es gente que esté en el primer frente, ¿no? Esté al día a día. Y le damos mucha importancia al tema de fronteras. Para nosotros es muy importante el tema de fronteras. El tercer tema es que el plan, digamos, ya salió la política y viene el plan, que viene a ser el plan de implementación. Y definitivamente lo vamos a separar. Por un lado va cáncer con todo lo que es cáncer, y por otro lado va cáncer infantil. Tiene que haber un plan de implementación dedicado solamente a cáncer infantil, Lucho. Eso tiene que ser así. ¿Por qué? Porque tenemos que visibilizarlo. ¿Por qué visibilizamos las cosas? Para que tengan más, disculpen que sea tan práctica, para que tengan más presupuestos, para que tengan más recursos humanos asignados, para que Bolivia inicie el trasplante, para que lleguen a tiempo las medicinas, para que exista esta red fabulosa, me ha encantado la red de Chile, ¿no? Que tiene 11 sitios en todo el país donde se pueden hacer descartes y todo lo demás. Yo creo que la idea de los comités andinos son esa, compartir nuestras experiencias para todos juntos avanzar. Hay países que tienen más experiencia en unas cosas y hay países que tienen más experiencia en otras. Justamente por eso nos caracterizamos. Entonces yo creo que de todas maneras tenemos que seguir trabajando como comité. Quiero reconocer el compromiso de todos los que han participado en el comité para la generación de la política. Quiero agradecer profundamente a Lucho Bengolea, que ha estado liderando esto. También a nuestros consultores que han ayudado en la formación, en la elaboración. Y bueno, pues sigamos para adelante, ¿no? Ya tenemos una resolución firmada por ministros, ya estamos decidiendo que el plan de cáncer infantil se va por un lado para que no esté porque es terrible, pues somos, ¿no? Me corrige Liliana, somos 1 o 2% de todo el cáncer, entonces si no salimos aparte, realmente no vamos a estar muy visibilizados. Eso hay que reconocerlo, ¿no? Hay que reconocerlo, así son las cosas. Y agradecemos profundamente a todos los participantes con todas sus ideas, con todo lo que nos escriben. Muchísimas gracias, vamos a hacerles caso. Hacemos un webinar con todo lo que es vamos a traer pura clínica para que todos estemos enterados de cómo hacer las cosas. Cierro diciéndoles que definitivamente hay un tema muy importante y es el tema del compromiso. Mientras más estemos comprometidos, mejores resultados tendremos. Y los invitamos al siguiente webinar, que va a ser el próximo jueves, que va a ser interesantísimo, porque el tema es superando las barreras de la justicia social. ¿Qué tendrá que ver eso con nuestro trabajo? Tiene que ver con nuestro trabajo, porque nosotros trabajamos para que se disminuyan las desigualdades y las inequidades y apostamos por la justicia social y ahora por la justicia ambiental. Nos estamos viendo y muchísimas gracias a todo el equipo de Horas Cono. Muchísimas gracias por la presencia de Mauricio. Hernán, no sé si ya se fue. Muchísimas gracias Patricia, Liliana, a Omaira, María, por ahí veo ya se fue también, no, ahí está, Esi, y a todos los que han estado en esta reunión. Gracias, Lucho. Nos vemos el jueves. Gracias. Buenas tardes.